just telling Sarah, Armand. Yeah.
Okay, thank you.
Okay, well, you're live.
Good morning. Welcome to this virtual meeting of Cornwall Council's Health and Adult Social Care Overview and Scrutiny Committee. Before consideration of today's business, I will outline the protocols for this meeting. Today's meeting is being live streamed to the public via Microsoft Teams and is being recorded. If the council live stream fails the meeting and we cannot share the proceedings, I will adjourn the meeting so we can access can be restored. If the issue cannot be resolved, I will halt the meeting, and the remaining business will be concluded at a future date. If members experience technical issues, I will adjourn for a short period to try and re-establish their connection. Members wishing to speak or ask a question should indicate by typing X in the chat box. As I call members to speak, I remind you to switch your microphone, and if you cannot be heard, the Democratic Governance Officer will advise you. Votes will be taken using a roll call procedure. The Democratic and Governance Officer will read out the recommendations and the name of the proposer, seconder, and will call each committee member in turn. You should confirm your name and advise whether you vote in favour or against the recommendation, or whether you wish to abstain from the vote. The Democratic and Governance Officer will count the votes and advise the result accordingly. X number for, X number against, or X number of abstentions. Where the members have a non-declared or non-registrable interest or disclosable pecuniary interest, or an interest by virtue of being a member of a trade union membership in a matter, you must leave the virtual meeting. Their departure will be confirmed and they will be invited to rejoin the meeting at the appropriate time. Just one piece about housekeeping. I would ask members to keep to one question initially each, and then any additional ones that we have time for. Items will be taken as read, and only additional information, which will be, I believe on one occasion today, will be added by the officer that's presenting the report. I hope that's clear. Before we start today's meetings, I will ask the Democratic and Governance Officer to confirm members' attendance.
Good morning, members. It's Leanne Martin, the Democratic and Governance Officer for the committee. It's nice to see you all, albeit virtually. It feels like a very long time. So if I can go through the roll call, if you can confirm that you're in attendance, and please confirm your electoral division. So I will call your name starting now. So Councillor Biscoe.
I'm Brett Biscoe, and I represent the Boscawen electoral division in the town of Truro.
Fantastic, thank you. Councillor Ellenbrook.
Hello, Barbara Ellenbrook, and I represent Redruth Central.
Councillor Gammon.
Good morning, Councillor Jackie Gammon, Bodmin St Mary's division.
Thank you, Councillor Gammon. Councillor Kirkham.
Jane Kirkham, Falmouth Smithwick division.
Councillor Jenkin.
Loveday Jenkin, Crowan and Wendron division.
Thank you. Councillor Lennox Boyd.
Good morning, I'm Councillor Sheila Lennox Boyd for Saltash North. Thank you.
Councillor Colin Martin.
Hi, I'm Colin Martin, Cornwall Councillor for Lostwithiel and Vice Chair of this committee.
Councillor Nicholas.
Morning, I'm Councillor Sue Nicholas and I am the Divisional Member for Marazion and Perranethno.
Fantastic, thank you. Councillor Parsons.
Good morning, it's David Parsons from Bude.
Councillor Pollard.
John Pollard, Hale North.
Councillor Thomas.
Good morning, Councillor John Thomas, Lanner and Stillions Division.
Fantastic, thank you very much. Councillor Toms.
Councillor Almond Toms, Lou East and St Martin's Division.
Thank you. Councillor Ver. Councillor Ver not in attendance at the moment? Okay, I'll mark him as not in attendance, Ver, but I will monitor to see if he joins the meeting. Councillor Williams.
Good morning, everyone. Councillor Peter Williams, representing Mabe, St Glovius Parish and Perna Worthall.
Brilliant, thank you. And is John McLeavy present? He's not. Okay, thank you. I'll monitor for his attendance. John McLeavy is our co-optee from Healthwatch Cornwall. Cabinet members in attendance. Councillor Hawkin.
Good morning, I'm in attendance.
Fantastic. Councillor Rothschild.
Yes, good morning, I'm here.
Fantastic, thank you. Just so members of the public and members are aware, we will have a number of officers in attendance throughout the meeting for particular items. So they will be Helen Charlesworth-May, who's the Strategic Director for Adult Care, Ruth Goldstein, who's the Assistant Director of Public Health, Caroline Court, who's a Public Health Consultant, Julie Dawson, who's the Managing Director at Cornwall Partnership Foundation Trust. Kate Shields will be attending from late morning. She is the Chief Executive of RCHT. Meredith Teasdale is attending. She is the Strategic Director for Together for Families. Sarah Fisher will be in attendance and she is Head of Communications at CFT. Myself as Democratic and Governance Officer, and we will have an additional Democratic Service Officer who'll be running the meeting in the background, doing the technical production of the meeting, and she is called Jo Heather. Back to you, Chairman.
Thank you, Leanne. Right, policies for absence, Madam Clerk.
We've had one apology for absence received, and that was from Councillor Chopak.
Thank you. Declarations of interest from any members on the committee for any matters that we're talking about today. I see none in the chat box, so we'll move on. The minutes of the our last meeting on the 11th of March, which seems an awful long time ago, and that will start on, I'll read them out page by page. If you've got something, please come in and indicate on which page and on the which paragraph of the minutes, please. Page 1, page 2, page 3, 4, 5, page 6. Councillor Parsons.
Yes, thank you, Chair. The concern was expressed to the lack of progress, that paragraph there. There will be a report in terms of reference for the inquiry to be brought back in July at the latest. I appreciate that that's not been possible for many reasons, but have we got any indication of timescale for that, please?
I don't have one personally. Leanne?
Hi all. In terms of points of accuracy, obviously it is July and we don't have thing, but it will come up under the work programme item this morning.
Thank you. Page 7, page 8, page 9, page 10, page 11, 12, 13, 14, and 15. I'll propose, do I have a seconder for that, please? Councillor Martin?
I'll second, Chairman. Let's go.
Right. Yes, that's fine.
Okay. Thank you, Councillor Biscoe. Shall we go to the vote then? Ms. Martin?
Yep. So the recommendation to agree the minutes and then be signed by the chairman. If I can just go through you all. 1 second, I need to get my spreadsheet up. Can you answer if you're voting in favour, against or abstaining? So Councillor Biscoe.
For.
Councillor Ellenbrook.
For.
Councillor Gammon.
For.
Councillor Jenkin.
For.
Councillor Kirkham.
For.
Councillor Lennox Boyd.
For.
Councillor Martin.
For.
Councillor Nicholas.
For.
Councillor Parsons.
For.
Councillor Pollard.
For.
Councillor Thomas.
Abstain.
Councillor Toms.
For.
Councillor Burr, have you joined the call? No. And Councillor Williams.
For.
Okay, so that is 11 in favour with 1 abstention, so that is carried.
Thank you, Ms. Martin. Go on to the next item, which is the questions from members of the public. We have received one question from a member of the public. I will read the question. The Vice Chairman will read the response, and Helen Charlesworth-May, the Director for Social Care, will come back in and reply on her behalf. So the question is from a Mr. and Mrs. S. Johnson of Hale, and will Health, Adult, Social Care Overview and Scrutiny Committee be conducting a formal public inquiry into how the COVID crisis was handled in Cornwall, including evaluating the actions and the contributions from central government, NHSE, PHSE, CC, and the local NHS bodies. Councillor Martin.
So thank you for the question. A national public inquiry into the handling of the COVID pandemic is absolutely essential. And it must be conducted without delay so that lessons can be learned before the predicted second wave hits in the autumn. However, the powers and capacity of this committee to hold inquiries are far more limited than those available to the government. First of all, this committee has been working for almost 2 years to set up an inquiry into child and adolescent mental health services. The council constitution only allows the committee to hold 1 inquiry per year, so an inquiry into the handling of COVID would have to be held next year, or we would have to delay the CAMS inquiry even further. Neither of those are acceptable outcomes. There are also limitations to who we can call and what we can ask, so the effectiveness of an inquiry by this committee would be limited. We've learned the hard way that scrutiny committee inquiries are incredibly slow to set up, so we would be unlikely to achieve a meaningful outcome before the autumn. However, we do recognise the importance of the questions raised by the questioner. We as committee members have already been involved in many private briefings with the officers involved in the response to COVID, both within the health service and the council. And crucially, today's meeting is the culmination of the questions that we've been asking behind closed doors. So over the hours ahead today, you will see many of the important questions being raised and hopefully answered. And we as committee members will continue to ask those questions of the council, of the committee, of the cabinet members, and of the health service and of the government until we are sure that we are ready to face the next wave when it comes. Thank you again for your question.
Ms. Charlesworth-May.
So decisions relating to COVID-19 by organisations within Cornwall were taken in the context of government guidance or statutory requirements. Lessons learned reports have been commissioned by each of the organisations, and we are all committed to bringing those to the committee when completed for scrutiny. In fact, there is one on the agenda today. Organisations will take the feedback from the discussion that we have with members and from those lessons learned, and consideration will be given to how we act upon members' views. In terms of changes that might have been made during the pandemic, so changes to the way in which we deliver services or the way in which we operate, so changes which may have been made during the pandemic, which might be made permanent, will follow the appropriate existing pathways for engagement and decision, and they will come forward to the committee for consideration as appropriate.
Thank you, Ms. Charles-May. The Democratic Officer, Joe Heather, I see we have our Health Watch attendee just come in. Do you want to do a check with him, please?
Yes, I can do, Chairman, if you'd like me to. So, John McCleavey, I understand that you're on the line. John McCleavey?
He's on mute, by the looks of it.
Sorry about that. Yes, John McCleavey, Health Watch Cornwall. Sorry, I didn't join the call earlier. I am here now.
Thank you, and you can hear me okay?
Yeah, fine.
We've just done a technical check for everybody, so if you could just type text in the chat box, I'd be grateful.
Okay.
Back to you, Chairman.
Okay, thank you for that, Ms. Heather. Go on to item 5, which is the work programme. Ms. Martin, are you going to take this one?
I am indeed. Thank you, members. As the chairman mentioned earlier on, papers are taken as read. I just wanted to highlight a couple of things. One is that the work programme event that we held on the 22nd of June has been reflected in the draft work programme in front of you. You already are aware of the 4 ways of working that are open to the committee. And just to highlight that where we are doing informal development work, where possible, the council, we will be adding to the public library that's on our website any papers so that the public can see them. And we do have a couple of updates. So one is regarding mental health strategy and some significant information development around that. That work has been undertaken, and I've had a commitment and offer from the relevant officers for that to come to a meeting prior to Christmas, as that's taken forward. And I know that today's agenda may well give rise to further items which might be added, so that can be done at that point. There was, I have made members aware, there was a recommendation from the Neighbourhoods Overview and Scrutiny Committee with reference to drug and alcohol services and a report into the budget for those services. So please, could members consider that when looking at the work programme? Obviously, child and adolescent mental health has been something that the committee has been concerned about for some time. I know there has been repeated requests for an inquiry process, and various work has been done to try and enable that to happen. Meredith Teasdale, who is the Strategic Director for Together for Families, is on the line. So if members did have any question relating to the structure or proposal for an inquiry into CAMS, she would be available to answer questions if required. I'm happy to answer any further questions.
Okay. Ms. Teasdale, would you like to say a few words?
I'm more than happy to, if you would like me to, Councillor Almond. The Children and Families Overview and Scrutiny Committee has committed looking at emotional health and well-being in the round. It's part of the meeting in August, and then again in January, where emotional health and well-being and targeted specialist support will be looked at in detail. Throughout the pieces of work that One Vision Board and Together for Family are looking at in response and recovery plan is emotional health and well-being, including CAMS, and that's being overseen and scrutinised by the Children and Families Overview and Scrutiny Committee. I hope that helps, Councillor Almond.
Thank you. Councillor Kirkham, you've indicated you wish to speak.
Yeah, just a couple of things on the work programme. The first is the merger, which is scheduled for the 23rd of September. I was going to ask for a few more details about the timing of the merger, because that obviously is a couple of months away. Now, is this merger something that's very imminent and we should be looking at before then, or can it wait until the end of September? And the other thing I was going to say is talking about the public question, the potential of conducting an inquiry about the effect of COVID in Cornwall and the national response and whether that helped us or not. We have discussed before, when it came to the CAMS inquiry, about the potential of maybe taking half a day of a meeting and dedicating it to a certain topic. I wondered if that's something that other members would be interested in doing when it came to later in the schedule, maybe in one of the autumn meetings, looking at the reaction and response to COVID locally and really nationally, and how that impacted upon us.
Chairman, are you happy for me to come back
Yes,
in?
yes. Please.
Regarding RCHT and CFT, there is a strategic intention. It's not any more than that at the moment. So it's been scheduled in the timescale that we believe is appropriate. If that changes, then obviously we can amend that. We haven't received further detail on that at the moment. In terms of the potential for half a day on an inquiry for COVID, that's entirely up to members if they feel that can be achieved within half a day, or if they wish there to be specific reports they want to be brought, which could take a briefing for half a day and work it that way. Specific information that's brought, if they could identify what that is, it would help. So there are the options, and hopefully some clarification on those too.
Thank you, Ms. Martin. Councillor Martin.
Thank you. Thank you, Meredith. I think it's important to put into context that this committee has been talking about problems in the provision of mental health services for over 3 years now. It was actually the very first question I asked when I joined the committee in 2017 about whether CPFT were dealing with CAMS referrals in the correct time scales. And what has emerged over that time is that there are a series of gaps between services through which some of the most vulnerable children in Cornwall keep on falling. And so what we've attempted to do as a committee is ask, alongside the Children's Committee, for an overall briefing that sets out the spectrum of services that are available, right from the preventative well-being resilience at one end, right the way through the offering of healthcare interventions, right the way up to hospital inpatient care. And the idea is that once we've had that overall picture of the spectrum, that we can then identify a couple of areas that we want to look into in more detail. And I understand that the Children's Committee are looking to focus on the wellbeing and resilience side of things. And so this committee would really like to be able to have the opportunity to see that spectrum and pick where we think the gaps are, so that we can have an inquiry in a really focused and effective way to how to bridge some of the most severe gaps. we've been prevented from getting started on that because we keep on being told that it's too complicated to put together. And so simply all we're asking for is a briefing that covers the spectrum and then allows us as a committee to pick one thing to go on and get on with. We were told in February that you newly arrived in your post had commissioned some mapping exercise so you could understand the spectrum of services that's available. So really we want to know, we need to see the results of that, and we need to see a briefing in the next month or so to tell us the results of that mapping, so that we can see what the services are, so that in September we can come and have a go at choosing which topic we want to look into in our inquiry. We can't wait any longer than that, because then we'll be into Christmas, and then it'll be the new year, and then it'll be the election campaign. So that's what we're asking for, really, is to be given that briefing so we can get on at our next meeting and choose where we're going to do our inquiry.
Okay, Ms. Teasdale, do you want to come back in on that, or?
So I'm happy to. So the meeting in August, so I mean there's two elements to this. One is that during that period of time between March and now, we have been in response phase of COVID-19, which obviously has been the main focus of ensuring that our children and young people are safeguarded and protected in a very difficult circumstances, that our schools have remained open for key workers and for our most vulnerable children. And that has taken a huge amount of energy and focus for the entire partnership, including CAMS, CFT, and also RCHT and Devon and Cornwall Police that we've been working very closely with. The piece of work that Children and Family Scrutiny Committee are looking at in August, on the 5th of August, on Wednesday, is that mapping exercise of where our provision is and what we are doing around emotional health and well-being and resilience for all of our children, but also for our children within specialist services. So that piece of work has been mapped out in spite of COVID, which is a real testament to the officers working in that area and that arena. And emotional health and well-being has continued to be a focus during that period of COVID-19. So that piece of work is being taken to scrutiny. My understanding from the Constitution, which may be different, is that the information should be going to one scrutiny committee, and that in that sense the children's, young people and their emotional health and well-being does fit within children and families. But I wonder if there's some conversation to be had with the chair of the scrutiny about whether there is information that whether there is a way of ensuring that Councillor, you also have that information and are involved in work that the Scrutiny Committee are looking at and targeting over the coming weeks and months.
That sounds pretty positive. So we're enormously grateful for all the work that everybody's been doing during the pandemic, looking after our most vulnerable children. I'm pleased to hear that it sounds like you have made progress with that mapping exercise, and perhaps if yourself and the chair and I and Leanne can talk outside this meeting about the most effective way for this committee to get that information, so that when we come back to our next meeting, we're in a position, our next scrutiny meeting, to decide exactly which bit of the spectrum we want to focus our inquiry on.
Okay.
Thank you.
Okay, thank you. Councillor Parsons, you're next on the list.
Thank you, Chair. Two things really. First of all, on CAMS, I'd really like to reinforce what Councillor Martin was saying. I was involved in the previous Health Committee when we held an inquiry day into CAMS, or in fact a two-day inquiry into CAMS, and it found very significant differences between what the providers of the service thought they were doing and what the receivers of the service were experiencing. And that's the concern I have with this. Now, it's been a long time, and I think the way that Councillor Martin suggested is very sensible, and I hope we can get this inquiry done before Christmas so that we can just test some of the potential of the system. The second thing I'd like to bring up is an issue that's come up a number of times in this area, in that people from this area have to travel to Devon for cancer treatment, for radiotherapy and for chemotherapy. And it does seem to be a recurring problem that when they go into Devon, because the policies of the commissioning group in Devon are different to the policies in Cornwall, then it causes a great deal of confusion. For example, the latest person that's come to me has to drive his wife to Exeter every day for 28 days. That's something like 116 miles every day, and over 28 days that mounts up to nearly £500 in petrol costs. When he's in the cancer treatment facility, he was told that he should expect help. He goes to the office and he's told that because he lives in Cornwall, he isn't entitled to help. Now, that's not accurate, and that situation has been sorted out. But what I would like on the work programme, it doesn't need to be an item on the committee, but I would like a report on what the policy for Cornwall is to support patients who have to travel very long distances to access cancer treatment at considerable expense, and how that policy compares with other commissioning groups so that we understand whether people in Cornwall are getting the same kind of level of help as patients in other parts of the country. Thank you.
Thank you, Councillor Parsons. I'm sure the Royal Cornwall that's on the meeting at the moment will take those concerns. Perhaps we can have a briefing note sent round to all committee members, please.
I think it's a CCG policy, so I will contact the relevant officer at NHS Kano and ask for a briefing on the policy for travelling for cancer treatments, and see if there is a comparator with Devon and where the differences are, and whether or not they can be alignment if possible.
Thank you, Ms. Martin.
Thank you very much, Chairman. I just think that in this area, people just don't understand the kind of distances people have to travel to get that kind of treatment. But thank you for that. That'll be very helpful.
Thank you. Councillor Nicholas, and I'm sorry I missed you on the chat box. I will take it that both your access are...
the same thing, yeah, absolutely. That's all right. Yeah, on the work programme, page 31, Peninsula Clinical Services, which does concern me because we haven't heard very much detail about this Peninsula Clinical Services and how it's going to affect the residents of Cornwall in where they're supporting or proposing treatments or whatever. It concerns me because it's dated as after, well, it must be after April or May 21, because it says date to be confirmed. That will take us into either the 6 weeks of purdah or after the elections, and I wouldn't like this committee to not have any heads up or know what's going on about this. So if nothing else, I think we should have a report on this as to see where things are going and what's being done in the background. Thank you.
Chairman, could I just reply to Councillor Nicholas? It's that there was unscheduled purely because I've asked them for information and hadn't had any back at that time.
Right.
I have now had some information back from them, so that will be disseminated to members. It came through quite recently, so I have that information. I will send it through. There may be that members want to proceed after they've received that initial feedback and response, but that will be going out to members forthwith.
Lovely, thanks very much. Thank you.
Straight on to Councillor Pollard.
Thank you very much, Armand. 2 points for me. First of all, to support Colin on the CAMS stuff. I think what's missing here through all this discussion we've had for now, you say 3 years, I say 10 years, is a real dig at the quality of the provision. And my concern is that this is falling between the two stools of children's and health. And I do think that this is one example of many where a joint committee is essential, because they'll do a piece of work on CAMS and we'll do a piece on CAMS, and never the twain will meet. So I urge, please, Armand, the chairman and the vice chairman of this committee, to again try to force the issue. There is total reluctance by officers to allow us to have a committee. I understand the constitution and the constitutional position, but it could be changed, and I think that is essential. My substantive point was on the relationship between the informal committee development meetings and this formal meeting. So, for instance, I am still very concerned about dentistry. I think dentistry has been decimated by the COVID-19 crisis. There's only a couple of paragraphs on the COVID report on dentistry, and I'll raise my concerns there when we get to it. But dentistry is down on the work programme as an informal committee development session, information session, and yet how do we get something from there to the formal committee? Is there a process? And secondly, Loic Rich put a motion to full council over 12 months ago, and we have gained a lot of information about dentistry, but we've taken no action. We have never ever written to the minister and said this is unacceptable, in my understanding. And yet people in Cornwall can still not access a National Health Service dentist. And at the point of time where they're being charged 40 quid, if they can get an appointment with a private dentist, I think the National Health provision is essential. So how do we get something from the informal information session back to the formal session where we can take some action?
Thank you, Councillor Pollard. I did speak to Leanne only probably 2 or 3 days ago about this very issue. We need to do something because of the charging. I did write to NHSE about the issue of charging for PPE. I've not yet had a response, and I have chased it in the recent past. In fact, I've sent it to Duncan Selby, the head of NHSE, for a reply. So that letter's been written, and we'll see what the response is. Miss Martin, do you want to come back in?
So I have been in contact with Tessa Fielding at NHSE. She has spoken to the committee before, and we were due to have an update on dentistry in springtime, which obviously was delayed. They are doing their new strategy, which includes provision for Cornwall. So I've asked her to bring an update to that, which we could then ask for to become a formal item on an agenda in the future when we know exactly what their plans are. I have been in contact with her again post-COVID, so I am trying to find a date for that, but I will go back to her and stress the urgency of that information coming through. Members can add a formal report to any meeting that they wish to take forward. So if you wish to request a formal paper on dentistry, then it's within your gift to do so.
Okay, thank you, Miss Martin. Councillor Pollard, we'll make that as maybe one of the recommendations at the end of this session.
Yeah, that'd be really good, Armand. I mean, I think we're due to discuss it informally in September/October. Therefore, I would propose that we put it on the agenda for the next meeting of the formal committee now, so it is there, and then we can take some action. I just feel we've let full council down. They endorsed the fact that Loic's proposal should come to us, and we've actually done nothing with it.
We'll put that on as a recommendation of the committee at the end of this session. Councillor Jenkins, please.
Yeah, thanks. I wanted to endorse the thing on dentistry. Certainly, it's something that's been like CAMS sitting around for a while, but that's not to detract from the fact that CAMS has been sitting around ever since I've been on the council, I think, whereby we've only had an imperfect look at things. And I do agree that we need to focus in on what the key issues are and where the key gaps are. But I totally agree with Councillor Martin that in order to understand that, we need to take a whole system approach and understand the whole system and all the different services. And it sounds like that's the piece of information that's been missing from this council in terms of identifying the gaps. So if there needs to be a piece of work to identify the gaps, then I think that should be done sooner rather than later. And because it crosses over the two committees, again, you know, working, even if we can't work as a single work committee, we decided, I think it was a year and a half ago, that we would work in parallel on this, and that it would all combine together at the end. And yes, a lot of things have happened in that time, but that should still be the philosophy, that we can work in parallel with us looking at some more of the medical, you know, provision versus the general well-being, etc., and just try and get a handle on why our young people are being failed by the system, because they are. You know, there are gaps. People are falling through the net all the time, and I'm constantly being contacted by people and who are having difficulties in that regard. So yes, can I just ask on the 25th of November adult social care charging policy, when is that due to come in, the new policy? Because I thought it was due to come in earlier, but maybe the dates have been changed.
Ms. Martin?
I'm not sure if Helen Charlesworth might have a better timescale, but the consultation was delayed because of COVID. So there has been a delay in taking forward the consultation to allow the majority of people to be able to take part in that consultation. So I know that there was a delay. So the timescales that have been put in the work programme report are based on the new project timeline. Okay. So it should still be okay.
So we will have an opportunity to review the consultation and give our views on it at that point. It won't be set in stone by then.
My understanding is that you will be able to do that. The consultation, I think, might be live. So Helen has just indicated that she wanted to come in, so she might want to give you further.
Ms. Charlesworth,
yes, just to confirm, so the consultation is live at the moment. It was postponed. The start of the consultation was postponed so that because of the pandemic, because that wouldn't have been appropriate. We launched it at a point in time when we were able to start engaging with people again. The period of consultation is absolutely in line with statutory requirements, and it will come to scrutiny before it goes to Cabinet.
Okay, thank you for that.
Yeah, thank you for that.
Councillor Biscoe.
Chairman, I just wanted to make an observation, if I may, about some of the discussion. It seems to me that when I first came onto this committee, I raised a question. I'm not sure if it's a question or a point, and that was that in looking at how we can bring adult care and health together, and how we can make sure that we've got an adequate health service, we really do need to look at the spatial provision of our health services in Cornwall. and to ask ourselves whether, given the size of population and the increasing complexity of care that is provided and is accepted as being a norm, whether actually we've got an adequate spatial provision, enough hospitals, for instance, enough surgeries in the right places, and so on. And I have sat on this committee ever since and listened to evidence. I remember vividly the head of the ambulance service coming and saying about response times. And I've listened to what John Pollard says about, and Loic say about dentistry. And I listened to what Colin Martin is saying about children's mental health as well. And it seems to me that the one question that we're not prepared to ask, which we really should be demanding is asked, is have we actually got a health service in Cornwall that places people within reasonable reach of a range of services which meets their needs? Now, we're about to consider the Public Health Director's report, which is very strong on sustainability and reducing carbon, actually reducing carbon, not netting it, and so on. And it seems to me that when Councillor Parsons raises the point that somebody's going to have to travel 116 miles round trip a day to get cancer treatment because they live in Bude, that there is an inequity there which actually goes beyond what minimum levels of service are supposed to be in the National Health Service. And you can find those sort of distances being travelled by people all over Cornwall to get basic health care. And it seems to me that we do need to challenge this. Our population is increasing, our complexity of need and care is increasing, and the National Health Service seems to be receding in terms of its presence and the demands it places on people to access it. And I find myself increasingly concerned by that. And I find myself, especially when I hear us saying, well, we can't carry out a public inquiry into how we've done over COVID because somebody else would be doing it on our behalf. I find that an inadequate answer. I think we should be asking these questions, and I think we should be making a case to the government that if they are seeing changes in the demography in this place, population has doubled since 1952, then or 1974 actually, then we need to actually make sure we've got adequate services. And although everybody in the services does a brilliant job, and so on, and they are fighting fire because they haven't got an adequate provision in order to be able to do that. And that's not just about systems and money, it's actually about places to do it as well. So sorry, I need to make that point. I think the work programme is fine. I support Colin Martin absolutely entirely, and I support John Pollard in the dentistry issue. But I think mental health, the children's mental health has been going on for 50 years, Chairman. In truth.
Okay.
Sorry.
Thank you, Bart. You always put it so well. Councillor Gammon, please.
Hello. Yes, I want to support the councillors that have spoken before me, on particularly on the CAMS and the mental health. I mean, I work in mental health myself, and I see firsthand the failings that we have, and we are failing people, and we are failing children. I stopped working with children about 6 years ago and switched to adults. And 6 years ago, we had children that were falling through the gap. It's one of the things that drove me to become a councillor. It's one of the things that drove me to ask to be on this particular committee. And I must say as well, I am fortunate that I also sit on the Children's and Families Overview Scrutiny Committee, and I am hearing the same reasons as I'm hearing here. So it seems that we as councillors, as Scrutiny, are falling through some kind of gap as well. It is important. It is important because if we can, I now work with adults. I am working with adults that were failed as children. So it isn't just the children we're letting down, it is the adults that those children will become. And that is also expensive financially. If we if we provide the support for the children, they do not become adults that need mental health care or worse. On the dentistry, I brought this up myself either here or at the Health and Wellbeing Board when I was a member of that board, because even when you have a dentist, as I do, You are on a dental list, but if that surgery doesn't have a dentist, you don't get to see a dentist. I myself and my family, even though we are registered with a dental surgery, have been without a dentist for nearly 2 years now. We need to look at this. We have children with rotten teeth. What is the point of providing toothbrushes and toothpaste in school if they're not getting the treatment that they need? It's just ludicrous. Sorry, thank you. No, it's one more point. We are doing everything we can to become carbon neutral and to protect the environment. What is the point in having a healthy environment and a healthy planet if we as human beings are not healthy mentally and physically? There is no point.
Okay, thank you. Well put, Jackie. Right, Leanne wanted to come in, and then I'm going to go to the last person, which is Barbara Allenbrook.
Hi, yes, Chairman. I believe Helen Charlesworth May might want to come in as well, but I will double check with her if that was the last discussion. Just to say, I know that we discussed dentistry and CAMS at our work programming event, and that we can make them highlight them in a more forceful way, or in the work programme going forward, as at the request of the members so far. So those two can be picked up and sort of strengthened within the work programme. I did try to include them as much as I could on the work programme before you following, because they were the same things that came out in that session, but we can make them sort of more of a priority in the work programme that goes forward.
Ms. Charlesworth, May?
I wasn't planning to say anything, but clearly, if Scrutiny wanted us to bring something forward on dentistry or any other item, we would be happy to respond to that.
Okay, and the last person is Councillor Allenbrook, please.
Thank you, Chairman. I'm back to the adult social care charging policy, and if I could, I will just read you something that I was sent. I sit on the Carers Partnership Board, and what I am told is this: carers are exhausted, particularly those who are now caring 24/7 without respite. To consult on the charging policy at this time will not allow the voice of carers to be heard. Many will not have had time to attend webinars and value face-to-face contact. Others face digital poverty, prohibiting them from joining in. I am very, very concerned on behalf of the people that are on this board, that are part of this board, about the fact that I think there is no dispute that, along with a lot of other things this council is doing, that we need to have a revised or a good look at the social care charging policy. What I'm extremely concerned about is that there is a cohort of people who are carers who, because of COVID, and that is nobody's fault, have no access to daycare and stuff like that, and simply do not have the time or the energy to respond to this consultation. And my plea would be that what we do is we have a look again at how this consultation is actually taking place. So is this really the appropriate time to put it on the work programme, or should we have it on the programme but actually be very mindful of the fact that there may well be a lot of carers who have not been able to be consulted, because I think the consultation finishes something like mid-September, which, given the news today that they think possibly we might be getting our spike sooner than later, is going to mean even more problems for those who are caring. Thank you.
Mr. Charlesworth May, do you want to come back in on that one, please?
So, for reasons of COVID, we took the decision to delay the charging consultation, and absolutely, if we thought there was going to be a further spike, we would probably suspend it. You know, we will do whatever we have to do in the moment should we see an increase in the number of cases of COVID-19 and we go back into response mode. In terms of the way in which we've been dealing with the consultation, we've engaged really heavily with those voluntary sector organisations, supporting carers, supporting people with disabilities, to ensure that we've shaped it in a way that is reflective of issues that we know affect people who are both caring or have disabilities themselves. What I would say is once we've got the outcome of the output of the consultation, we will then be in a position to take a view as to whether that consultation has been sufficient and adequate to inform our decision making, because clearly if it hasn't been, we wouldn't be able to make a decision. So I wouldn't want to stop the consultation. I would like to see the output from it so that we can make an informed decision.
Okay, thank you. Ms. Martin, do you want to come back in? And I'll just remind members, just one question each, because we're seriously over time on this subject and we want to give all the subjects that we have today sufficient emphasis. So please keep your questions as short as you possibly can. Ms. Martin.
Thank you, Chairman. So the recommendations are set out in front of you, that the committee work programme as set out in Appendix 1 be approved for the remainder of the term of the current administration, subject to any amendments made by the committee. Now, I have already noted that that dentistry and child and adolescent mental health and the strengthening of those within those two, and just checking on timescales for the charging policy and the briefing regarding travel to hospitals with cancer treatment. And the second recommendation is the authority to make further amendments to the committee work programme in response to new or changing priorities be delegated from the committee to the chairman of the committee in consultation with the vice chairman, the strategic director for adult social care and health, and the democratic and governance officer. The work programme will be circulated to committee members by email prior to each formal committee. If there is a proposer and a seconder, please.
I'll propose it.
I'll second that. That's Colin Martin.
Thank you. I will now do the roll call. So you'll have to bear with me once again. So, Councillor Biscoe, are you in favour?
For.
Councillor Ellenbrook.
For.
Councillor Gammon.
For.
Councillor Jenkins.
For.
Councillor Kirkham.
For.
Councillor Lennox Boyd.
For.
Councillor Colin Martin.
For.
Councillor Nicholas.
For.
Parsons.
For.
Councillor Pollard.
Sorry, for.
Thank you. Councillor Thomas.
For.
Councillor Tom.
For.
Councillor Ver, I believe you're now on the call.
Yes, for.
Thank you. Councillor Williams.
For.
That is 14 votes from the committee, so therefore carried. Thank you.
Thank you very much, everybody. We'll go on to the next item, which is the Director of Public Health's annual report. Who is going to take this one, please?
Thank you, Chair. It's Caroline Cork, Public Health Consultant. I'm just going to share my screen for the presentation. Thanks to the committee for the opportunity to present this report. Just waiting for it to fire up. So the theme for this year's annual report is planetary health. Definition of planetary health is the health of human civilization and the state of the natural systems on which it depends. So what we've tried to do in this report is to explore how climate change, environmental degradation, unsustainable use of natural resources, how that impacts on human health and well-being, global and national and a local level. So why is this important? Why is planetary health important? I think the main thing to say is we're already starting to see the impacts of poor planetary health, even in Cornwall. And without both mitigation and adaptation to the impacts, we will see significant effects on health and well-being in Cornwall, and also that the people who are least able to cope with these changes will be the ones that have the greatest impact, and therefore that potentially increases health inequalities. I think it's worth saying that this was we wrote this report at a time of pre-COVID. It was actually written December, January time, and we'd originally planned to publish it to coincide with the Cornwall Health and Care System declaration of a climate emergency. And there was going to be a health and care conference in March, but obviously events overtook us with coronavirus. We've made the decision not to rewrite any of the sections in the light of the pandemic, but I think what the pandemic does show us, it shows us the importance and the fragility of human health. It also highlights that strong connection between humans, animals and the planet, and also shows that we can dramatically change the way we live in order to protect health if we need to. I can just move on to the next slide. Yeah. So the areas of focus in the report, I won't go into them in detail, but you'll see that this is the list of the areas that we're focused on. And these are all areas where human health can be impacted. I'll just point out the section of disease, which actually, reading it now, seems quite prophetic. Because it focused on zoonotic diseases, so those are diseases that transfer from animals into humans. And talks about how human activity can lead to the emergence of new diseases. That chapter also finishes with the graphic on effective hand washing, which I'm sure we've all become much more familiar with over recent months. And then we came up with 13 recommendations. These vary from recommendations for organisations in Cornwall. So essentially things like encouraging putting planetary
rightly talk about carbon generation and so on, and although I would like to see it as much as an emphasis on active travel, I would like to see an emphasis on public transport as well. I think the two things are absolutely essential. I mean, active travel is more about health than it is about, wealth, if you like, and public transport together with digital communication are going to be the two means of conducting transactions in the future, and I think we need to be focusing on that. And I would like to see Cornwall Council and everybody else being challenged about how they're making the best of the options and possibilities we have for public transport. The other point for me is that there are things in Cornwall which will contribute to a broader picture of how we change minerals, the ability to generate aspects of that, things like that, elements like that. And I think that in looking at a report which is as wide-ranging as this, and considering what happens in Cornwall in relation to climate change, it's important that we ask the Public Health Director to actually take into account that there will need to be, for the greater good, both planet and people, some activity which may also impose on the environment and may also impose on the sort of economic picture that we develop in future. My real concern, particularly about minerals and metals, well, I suppose about power as well, is that we get control of the situation before the situation takes control of us. I would not want to see a similar situation occur in Cornwall to that which occurred in Scotland with regard to North Sea oil. And that risk is very, very much there. We have people prospecting all over the place, and we are not rising to the challenge of being the minerals authority in Cornwall. So that's a bit of a challenge to the Public Health Director.
Okay, thank you, Councillor Biscoe. I'm going to take them in three. So, Councillor Jenkins, please.
Sorry, can I just raise a point of order? I've been asked to try and help keep a note to assist the Democratic Services Officer in terms of the recommendations that people are making. So could the Chair just clarify? I know we're about 20 minutes behind schedule at the moment. Are we making observations and comments on this public health report? Or are we asking questions and making recommendations to alter the recommendations that have been put in the report?
If this committee was just to make a recommendation to the Director of Public Health, we could do that.
Okay, great.
I know it's just to note the report, but actually I think it needs to be stronger. And some of the points that Councillor Biscoe was saying are relevant to that. Okay. Okay, Councillor Jenkins, please.
Yeah, thanks. As Councillor Biscoe says, I welcome this report. It's a good attempt at trying to tie up the wider picture with what's going on in Cornwall. I think there are a few places where it needs a bit of more explanation, though, because I'm a bit of a data nerd, and I read through the main body of the report thinking, well, where's the data? And then the vital statistics bit is at the back, but there's not a lot of vital statistics there. So, and where you look at the the graphics, quite often you can't expand the graphics to see what's in them. So even if you look on screen and you expand them, you can't actually see even in colour what's going on, because the stuff gets blurred. I presume it's been copied and pasted from other documentation, but I know that the JNSA has got a lot more data in, but the links through to it is not really there. So if you want to delve into an area a bit more and say, what does it actually mean for this part of Cornwall, what we're saying, it's very much more broad brush than some of the things that we've had in the past. And I hate to go back to the work plan, but maybe there needs to be something underlying this, which is actually more about the detail of what the key issues are in Cornwall, and in different parts of Cornwall. We've got the indices of deprivation, but I struggle to understand what the indoors and outdoor living environment metric was from the description, for instance. So is there something that lies behind this where there can be web links through to it, or is this, I mean, I'm presuming it's not a printed document because we're not doing printed documents anymore, but if you look at it on the web, it's not all readable and understandable. And I would like to know what happens for, what it means in terms of the recommendations. The recommendations are fine, but they're very broad brush. And actually, what does that mean in terms of public health in the future in Cornwall?
I think Miss Martin wanted to come back in.
Hi, yeah, it's just to remind members around the climate change action plan. We had previously had a discussion around how this was approached. It was a long time ago now, so it feels like a long time ago now, and that the neighbourhoods OSC will be sort of undertaking the overarching action plan around climate change, and then looking at focusing what comes out of that action plan, and the committees can take sort of that focus look. So just to reassure members that this report would obviously link into that sort of overarching climate change plan that neighbourhoods are considering.
Okay, thank you, Ms. Martin. Councillor Nicholas, please.
Thank you, Chair. I am getting there. Yeah, the thing that I've been trying to get sorted out for a number of years is the issue about air quality. And I know under the Clean Air Act, the bonfires are not supposed to be covered in it. But, if we're talking about clean air and we're talking about air quality, then we should, as a council, bring in a bylaw that says that people are not allowed to light bonfires during the day, especially in good weather when it affects people who might have respiratory problems, who may have cancer treatments, and it stops them from enjoying their gardens. And for the rural areas, it's quite an issue. And I think something really needs to be done about it. I think also we need to see, if we're talking about climate change, and I agree with everything that Councillor Biscoe said about the rural areas and about food and food growth in the fields, but we've also, we've got this Cornwall forest, but actually we're still allowing developers to cut down mature trees in the rural areas to build houses on. And I think, we really need to get our act together. And I think we need to stop playing lip service to the climate change that we're saying we're interested in. And actually, I would like to see something really done about it and bring in some bylaws that are really effective in dealing with these issues. So I would like that proposal to come into it somewhere along the line, please.
Okay, I think Councillor Martin will take note of that. Miss Martin, you wanted to come back in?
Yeah, sorry, Caroline, I'm answering all the questions. But just to let members know that air quality actually falls under neighbourhoods OSC. As we were saying earlier on, there's lots of crossover between the different scrutiny committees. And just so that members are aware, Clean Air for Cornwall strategy is going to them for consideration in October. So that might be something that members wish to be involved in and keep a watching eye on. So yeah, Clean Air for Cornwall strategy is going to neighbourhoods in October.
Thanks. I hope they've got a bylaw in there then. Thanks.
Okay, thank you. Right, Mr. Court, do you want to come back in and anything you want to say on the first three questions?
Yeah, if I may, that'd be great. Just a couple of points. I think some of the points that have been raised are really important. The issue around having a opportunity to think about planetary health in all the council decisions, that's kind of the idea behind the climate change wheel. I don't know if people are aware of that, so that all cabinet and council decisions should have a climate assessment, and that includes health, and that gives public health an opportunity to comment. We also are looking at doing health impact assessments for major developments like Langarth. In terms of, I think Councillor Biscoe talked about how we promote this report. This is going to Health and Wellbeing Board. I would also hope it would be considered by Leadership Board and the Local Nature Partnership. The public health team is working closely with carbon neutral Cornwall team within the council to make sure there are the links up between those. And in terms of the vital statistics, we do those every year. They're a standard chapter of an annual report, and they do all come from the JSNA. But what we could do, to expand that, would be to have a chapter within the JSNA that was specifically on planetary health, that might help expand some of the areas that the councillors were talking about, if that would be useful. Thank you.
Straight on, Councillor Kirkham. Jay?
Hello. Yes, I think my questions have pretty much been dealt with, actually. I was just going to quickly ask about the 9 air pollution sites and whether we'd be measuring for any more, but I guess that will be covered in the Clean Air for Cornwall report that's going to neighbourhoods. I was going to ask a bit about our relationship with South West Water and how closely we work with them. Because obviously there have been some issues in Cornwall where the distinction between who's responsible for what seems to be blurred. So it would be helpful to know how close our relationship is with South West Water on some of those cases. And the farm strategy, again, I think you're going to tell me this is covered by neighbourhoods, but it was going to be updated to cover the climate emergency. I think I should go away myself and check if that has been done, but if somebody could just tell me very quickly, that would be helpful. Thank you.
Okay. Thank you, Councillor Kirkham. Very speedy. Councillor Ellenbrook, please.
Yeah, hopefully another couple of fairly speedy ones. I'm on the recommendations page and make the change to the pledges, number 4. And I quote, "Next time an electrical appliance breaks, I'll get it mended safely rather than buying a new one." There's a big gap in the market here. My mum's had a washing machine that did need a repair. She really struggled, and in fact, in the end, bought a new washing machine because she couldn't find anybody to repair it. So I think there's a gap in the market. I'm not sure that we can actually do anything about it, but I think we need to think about that. But the other thing for me is the green spaces and green gyms. I've been battling for ages. I've got a particular piece of land which is in a fairly big housing estate in my patch, where it would be really good to put a green gym in. And we don't seem to be using the facilities we've got to do stuff that's relatively simple and relatively easy to encourage people to be more healthy. So, you know, is there a way in which we can use this report to beef up Section 106 contributions that are supposed to be done for health, and actually get some of our open spaces provided with green gyms so that people can exercise outdoors safely and economically, because again, not everybody can afford to go and pay for a gym membership. Thank you.
Okay, thank you, Barbara. Councillor Martin.
Thank you for that. So I welcome all the positive high-level stuff that's said about a healthier planet leading to a healthier population. But I'm concerned that what's missing is we know that a lot of the most serious and expensive problems faced by the NHS are to do with lifestyle-related factors. And we're constantly being told by the NHS that the only way that the system is going to survive is if more preventative and early intervention work takes place. And I'm concerned that this report seems to have a lack of emphasis in that area. So I suppose I've got a question and a potential recommendation. So my question is, what proportion of the £850 million NHS Kerno budget, or the £1 billion plus Cornwall Health and Social Care System budget, is currently ring-fenced for public health, in particular for those interventions, those preventative interventions? We've heard that there's been some funding made available for social prescribers who can signpost people towards these activities, but very limited funding actually for running those activities. So how much funding is there ring-fence from the health and care system budget for providing those preventative activities?
Okay, thank you, Councillor Martin. Miss Martin, do you want to come in first and then back to Miss Court?
Yeah, it was just in response to Councillor Kirkham. You are entirely right that neighbourhoods OSC cover the farm strategy. It is being developed and it will go back to them in March. Just so members are aware, the work programmes, once they've gone through this phase of meetings, this round, the last one is children's next week, there will be a library in which members can see all of the work programmes for each of the committees, so you can keep an eye on them and see what information and papers are going to theirs.
Okay, thank you, Leanne. Miss Court, please.
Yeah, thank you. I mean, in terms of green space and using them for green gyms and using Section 106 funding, we often make recommendations for that and we totally support it. Of course, the reality is there are often competing demands on Section 106 monies for a range of other uses that have to be balanced, and that's the reality of it, and that is a case of making those decisions on what you prioritise. And similarly, I guess, about Councillor Martin's comment about the proportion of the budget that goes into prevention and for the health and social care, I can't answer that question. But again, it's another issue of competing demands, how much priority is put on prevention by those organisations. Thanks.
Ms. Court, there was one bit that Councillor Kirkham asked about South West Water. Any chance of looking at that, please?
Yeah, I'm not sure I'm the best person to answer that. We do have some, for instance, when we do a health impact assessment, there'll be contribution from South West Water, but I guess you'd have to consider what specific particular issue you're trying to address on that.
And perhaps those others listening might take heed of Councillor Martin's request to see how much money is being fired across from other organisations to public health. Perhaps we could ask that as a question. I'm sure Councillor Martin would support that.
Well, I think I would like to make a proposal that we would like to see a recommendation that 1% of the NHS Kerno budget should be allocated to funding preventative measures. But I don't know if I think Helen Charlesworth-May has just buzzed in there, so I'd like to hear what she's got to say on that.
Yes, Miss Charlesworth-May.
So I wasn't going to answer that question specifically, but I will come back to that. I think it's really important for the committee to understand that this is the report of the Director of Public Health, and it is now finalised. It specifically is the report of the Director of Public Health, so that the Director gets to say things which councillors or national politicians might not always agree with. So the report won't change, although I'm sure Caroline will take the comments back to Virginia, whose report this is, and to Rachel, so that we can start to think about what we might want to focus on for next year's Public Health Director of Public Health report. In terms of the Kerno CCG budget, we will be moving into a phase of reconsidering the long-term plan across the Cornwall health and care system. So post the pandemic, as we go into recovery mode, we'll be looking at the plan that we put together for this year back in January, February time. We will be looking at how much of that is still appropriate and pertinent in the context of recovery, and proposals for how we redistribute our monies will be coming forward. Clearly, we would like to invest in prevention, and I would say that there are many things that clinicians already do that come under the heading of secondary prevention as well as primary prevention, particularly in primary care. But clearly, everything we decide to invest in, as things stand, will require us to make decisions about things we will disinvest from, and we would need to bring those forward too as part of the scrutiny process.
Okay, thank you, Ms. May. Right, it's down to my question. I had a particular question after what Councillor Biscoe said. Although we're talking about bringing in, the wind farms and the renewables and everything else, and those sort of things, the trouble is with those, 90% of those that are already here are owned by the Chinese or by some other company that is not in Cornwall. I had a conversation with somebody the other day that they were saying that the percentage is up around the 80-90% are owned by people outside of Cornwall. To make the greatest impact and the best outcomes for the people of Cornwall, do you think that it would be good for the council to look at the issue of doing generation for the people of Cornwall from our own resources? And I think there was Councillor Nicholas was next on the list, and then that's it. That's the last question.
Thank you, Armand. Just to come back on what Caroline was saying about the contribution when there are major developments, the issue in the rural areas is actually small developments that are taking down lots of trees and changing the landscape significantly, and having bonfires and all the rest of it at the same time. So I think it should be considered that any development, not just major developments, are looked at in terms of health impact in the areas, because it's a cumulative in the rural areas that causes the biggest problems.
Okay. Miss Martin.
Thanks, Chairman. Apologies if there is some background noise. My neighbours have just decided to mow their lawn. Councillor Martin proposed an additional recommendation. There wasn't a seconder for that. Would you like to proceed with that recommendation, Councillor Martin?
Well, I'm slightly unclear on where we stand, really, because I'm looking at the recommendations. There are that we note the contents of the report and that we support the recommendations. So what we're saying is we're not allowed to suggest that the recommendations are changed in any way. Are we allowed to add anything that says that we want to call on neighbourhoods to do something about trees, or we want to call on NHS Kerno to more funding into the preventative measures, or is this not the right place to do that?
So the report is the Director of Public Health's annual report. It is written. It's from her. It's her view on that sort of the world, as it were. So in terms of influencing change on the actual wording of the report, no, it belongs to her. However, supporting the recommendations contained and detailed within the report, I think the committee could highlight areas that they wish to support or indeed not support. But yes, I mean, in terms of the wording and the actual report content, that is written and is,
sure.
is
Okay.
hers.
I will take a punt and we'll see if this is any good for anyone. So I would like to propose that we support the recommendations as set out on the page. So we support the contents of the 2019 Director of Public Health Annual Report be noted, and support that the recommendations of that report, but also note that we have concerns about the lack of funding for preventative measures from the rest of the health and social care system, and that we have concerns about the wider impact of air quality and public exercise space through the way that the planning system operates. Is anybody happy that that's a reasonable way to wrap up the comments that people have made?
I do have a seconder for your first proposal.
I'm not sure if Jackie seconded that before I reworded it. So if she's happy to second it as it is, that'd be great.
Councillor Gammon. Yes, Councillor Gammon is happy. Before we go on, there was Councillor Pollard that wanted to speak, and Councillor Biscoe. Quick one for Councillor Pollard.
Yeah, thank you, Aaron. I support what Colin's saying, and we are a scrutiny committee. We can do what we like, Colin. But I appreciate your concern about the way we do it. My concern is that we should not be noting any report. We're a scrutiny committee, so I think we should. My view, I would urge the proposer and seconder to change the wording to the fact that we welcome the report, but make the following comments and then add Colin's bits in. That would be my preference.
I'll be happy to amend the wording as John suggests.
Okay, thank you. Councillor Biscoe.
Chairman, it seems to me, I'm unclear from the report whether the Public Health Director's report is simply coming to this scrutiny committee and the Health and Wellbeing Board, or whether it's being referred to all scrutiny committees, or whether it's being taken up by the Cabinet, and whether they're going to look at it. Because it seems to me that if we are the only route in, which looks as if it is the case, then the important thing, because there's a general consensus of view with one or two caveats about the recommendations, the important thing is for this committee to feed the recommendations into the daily business of Cornwall Council. So I would like to think that what we could do is actually recommend from this committee to the Cabinet that they give due consideration to these recommendations with our support and whatever caveats are to be added, because this is, a lot of these recommendations have a very strong bearing on a wide range of council services well beyond the remit of this committee, but all of which contribute ultimately to the subject of this committee, which is health. So I think I would just like to suggest that what we should do is not note, but really actually not send suggestions back as to how they can change the report because it's already been published, but actually say to the Cabinet, we think that you should look at this, and adopt it as council policy, wherever, some of it already is council policy, but where appropriate. So I don't want to complicate your job by making a further proposal, but I do think that we should take that into consideration and maybe somebody would take that on board, because otherwise it's just going to go nowhere.
I'm happy to add the line then. So as well as welcoming the report, some more supporting the recommendations, plus adding our own notes about air quality, funding for preventative action, and the use of the planning system on trees and open exercise spaces. And then finally, to urge the Cabinet to take on board the recommendations of the report with our notes and urge them to put this into action in the work of the council.
Yeah, that sounds okay then. Miss Martin, is that okay?
Sorry, I was desperately scribbling. My understanding is that we have, so is it 2 recommendations, but the second one is rather lengthy? Is that my understanding?
If
or
you're
do you want to do it as
that
3 recommendations?
well, okay, let's call it 3. So one is welcoming the report. Number 2 is supporting the recommendations with the addition of noting our concerns about the lack of funding for preventive action, the planning system in how it relates to open spaces and trees, and the concerns about air quality. And then the 3rd is urging the Cabinet to take on board all of the above and put it into action in the work of the council.
Brilliant. So that's what I have. Are members content they know what they're about to vote on?
Just on the air quality, it's not just about air quality, it's about making a bylaw at Cornwall Council that prevents daytime bonfires.
Yes, so we are calling. How does that wording fit into what I've already said? So in the second bit about the extra note, that we are concerned about air quality, and we call on.
I mean, that could be picked up in the minute, that specific point, if there's a clean air strategy that's going forward.
Yeah,
unless it's that the clean air strategy, recommend to NOSC that the clean air strategy considers daytime bonfires.
Yeah, can we just separately make a note for the chair of the committee to write to the neighbourhoods committee to say that from a health perspective, we've got concerns about the health effects of bonfires, and we call on them to think seriously about a bylaw when they're reviewing their clean air strategy.
Yeah, that's great, because the Clean Air Act doesn't actually include bonfires, but making it specific would be. Thanks.
Okay.
Brilliant.
I will do that for you, Councillor.
Okay. I have proposers as Councillor Martin and Councillor Gammon as seconder. Are we still confirming? If you could confirm vocally so that it can be heard by the public, I'd appreciate it.
Yes, that's my proposal.
Councillor Gammon?
Sorry, yes, I'm in trouble. Yes, I'm happy to second.
Thank you very much.
Sorry, Chair, I did put in an X. I did want to make a little tweak.
Sorry, Councillor Jenkins, I missed it. The V was coming through quite quick. Yes, what did you want?
It was on the planning element, the wording on the planning bit, because within the recommendations it talks about building passive houses, but I think if that could be added into the bit about making sure that planning looks at these issues, if the passive house building could be added in, that would be helpful, I think.
In our notes to the recommendations.
Well, in the recommendation about the planning, consider planning in relation to.
Yes, so from a health point of view, we're making recommendations from a public health point of view. So in those details that we've added to note, that we want to then, so it wasn't something that was missing, but we're saying that we want to emphasise the importance of passive house standards in construction as soon as possible. And the reason for that is the broader climate change thing, but also they're much healthier houses to live in because they're more affordable to keep warm and dry.
Exactly.
Okay. You carry on now, please, Leah.
Okay. So just to check that addition, the proposer and seconder are happy to take that forward. Councillor Gammon.
Happy.
Fantastic. Thank you.
You want to carry on, please, Leon?
Councillor Biscoe.
4.
Councillor Ellenbrook.
4.
Councillor Gammon.
4.
Councillor Jenkins.
4.
Councillor Kirkham.
4.
Councillor Lennox Boyd.
4.
Councillor Martin.
4.
Councillor Nicholas.
4.
Councillor Parsons.
4.
Councillor Pollard.
4.
Councillor Thomas.
4.
Councillor Toms.
4.
4.
Williams.
4.
Thank you. Members, that's all in favour, and those recommendations are carried.
Okay, thank you, everybody. We're going to take a 5-minute break, a comfort break, back at about 12 minutes to 1. 12 minutes to 12, sorry. So switch your videos off and your mutes, please. Switch them off. Hello, everybody. We'll start the meeting again. I hope everybody's back in. Okay, thanks. We'll go on to item 7, the annual health protection report. Ms. Court, are you taking this one as well?
No, it's Ruth Goldstein taking this one. I think Caroline's actually left the meeting now.
Is she? Okay, thank you.
So shall I just begin? Yeah?
Yes, please.
Okay. Thank you very much for receiving this report. I believe this comes to you annually and sets out the health protection activities that have been going on in the previous year. You've seen the full report of the health protection is included, and then we've done a brief summary for everybody. So I hope that contains all the relevant information, and people just need to understand that the data in the report is from years 18 to 19. So the data is up to date as of April 2019. And the delay with the reporting of this data really comes from the data feeds for the screening and immunisation. So we have to wait at least an additional quarter before we get the updated data about our uptake. And that delays us being able to write the annual report and then bring it to you. So I apologise for that. It is something that is out of our control, unfortunately. I'm really happy to take any questions, have any comments about the report.
Okay, thank you. I have nobody at this present time that has come in to ask any questions. Any of the members wish to ask any questions? Councillor Kirkham, please.
Hello, I'll ask a question. I was going to ask about the screening and vaccination programs. I was going to ask if the pandemic had affected any of the screening programs this year. And I was going to ask about the flu vaccination program, because obviously they're going to be extended this winter. And I was going to ask how that extended program would be implemented, and were we kind of ready to do that in a bigger format. And I saw that there were 93 outbreaks in the year 18 to 19 in Cornwall. I just wondered how many we'd had so far this year as a comparator, really.
Do you want me to answer those questions now?
Yes, please.
Yeah, okay, sorry. And so how have the screening and immunisations programme been affected by the pandemic? I think I can say with some confidence, because we've been in touch with Public Health England throughout this, who actually commissioned these services on our behalf. Certainly the children's programme, so all the antenatal and the under 5s checks, etc., they have all been continuing as normal. People have been invited to those, I should say, as normal. And the uptake data is showing a slight drop off, but not at this moment anything that would give us undue concern. So that's encouraging. But I think it's fair to say that some of the adult screening programs, so the breast screening and the bowel screening and the AAA screening and diabetic eye screening, have all been affected by the pandemic and have been put on hold for new screenings, and they're just sort of starting to model how they're going to, well, they've actually started to re-deliver them and to try and bring people in a way that helps them catch up with the sort of time frame of the existing programs. So there has definitely been a big knock-on for adult screening, unfortunately. What we have had assurance with, though, is that anybody who pre-COVID had been identified as needing follow-ups from their screening programs up to sort of the beginning of March, those follow-up appointments have all been able to continue. People have been invited to those appointments. So there shouldn't be any of our population who had a screening result back in February saying they needed further investigations that haven't then been investigated. Your question about the flu vaccination program, there is clearly a need to make sure that we are all set up for a very comprehensive flu vaccination program this year. We are expecting that demand will be higher anyway because of the heightened alert system and concern amongst our population, and that on top of the fact that the government have increased the access to the flu programme. It will be available for people from the age of 50 upwards, although people from the age of 50 to 65 will be in a second cluster of people invited for a vaccination programme. Once the higher priority groups have had theirs. Locally, we've got an all-system flu programme committee looking at alternative ways of actually delivering it this year. To make sure that we can get high throughput, but also keep people COVID safe while we're getting that throughput. And so there are options being discussed across the health system at the moment to work through how best to do that, as are systems to actually ensure that all of our health and care staff get vaccinated this year. There is a national requirement of 100% uptake, which is considerably stretched from previous years. So work is in place to develop systems to get agreement of how we can do it, and then to implement different delays, which will probably involve some use of large sites where there will be drive-through vaccinations available. But that is all in the process of being discussed at the moment. In terms of outbreaks from 18 and 19, yes, there were 93. I haven't got a comprehensive list of outbreaks currently that we are of having. I do know that overall, so far with COVID, there have been 72 what we would class as outbreaks in various settings across Cornwall and the Isles of Scilly, but that clearly doesn't take account of any of the other communicable diseases. But I don't have that data to hand, I'm sorry.
Okay, thank you, Scolson. Councillor Jenkins.
Yes, ironically, I was going to ask about flu uptake as well, because looking at the 2017 and the 2018-19 data, Cornwall seems to be struggling compared with other parts of southwest Britain, and also even the data for England is low in terms of trying to get to 100% coverage, particularly for people in the care sector, and it's good to hear that there are people are looking at other ways of accessing the flu vaccine rather than having to be called to an appointment. But I wonder whether some of the new ways of working that have come in through COVID, like attending in your car to the GP surgery and having your bloods taken in your car, or having a vaccination given in the car without actually having to go into the surgery, might be something that could also be considered, so that people feel more confidence in going to the surgery and getting the immunisations. And obviously with schools not being out, has that impacted upon uptake of immunisations that take place in schools? And how's that going to work in the next term?
Yes, so your question around the flu, the methods that you've just described there, Councillor, are exactly the type of things that we're looking at doing. So the drive-through clinics, essentially, so people can stay safe from COVID and can access it in a different way, is precisely what the plans are looking at. That clearly requires a lot of agreement across the CCG and the main providers of the flus, but those the vaccines. But those are the processes that we're mapping out at the moment and having discussions with. And you're absolutely right. Our uptake of flu vaccines in Cornwall has been stubbornly lower than other areas. And in fact, we were looking to put in an enhanced programme this year anyway, based on last year's data, even before we got to the COVID situation and now the new stretch targets. So we are looking for innovation essentially, and trying to do a considerable amount of work so that we can meet those targets. In terms of the schools work, so we have a schools immunisation team who clearly haven't been able to do their work as effectively since March, and that mainly will affect the HPV vaccines that they would have given, and they are now have a plan for catch-up clinics so that they can put that in straight away in September before they then have to get into the October, November schools flu vaccination program. So they've got plans. We've been assured they've got plans. I haven't actually seen those yet. We haven't had one of our local immunisation group meetings yet, but when we have that, we will be seeing those. But NHS England and Public Health England have been working with the schools team to make sure that they are in place and that they will get us that catch up so that the schools population don't miss out for that year.
Okay, thank you, Ms. Golster. Councillor Annenbrook, please.
Thank you very much. Yeah, I'm very interested. I think we all will be in what the flu plans are. And could I actually ask that we get, if not a formal update at a formal meeting, perhaps a briefing note which actually explains to us how flu vaccines are going to be managed in Cornwall, because it is the sort of thing that we as councillors get asked by local residents. So that would be really, really helpful. I'm assuming that you're going to be using pharmacies as well, so you know that they are included in that. But my real kind of question is, and I can never pronounce this, so please excuse the appalling pronunciation, pneumococcal vaccinations. Now, I believe that when you're 70, you can have that and it's a one-off one. Well, given that COVID is essentially a respiratory disease, is there also any plan to make sure that those that are eligible for that vaccination, who are in the vulnerable group anyway, surprise, surprise, are actually encouraged to take up that opportunity as well? Thanks.
Yes, our pneumococcal vaccination rates, I personally have been quite unhappy with over the year that I've taken over this portfolio, and has been something that we've been talking with our CCG colleagues to look at a variety of ways to actually try and increase those, because it is a disease that affects older people. It is something which we can control, but it's something which doesn't tend to hit the headlines very often, and there is very poor uptake. That was pre-COVID, post-COVID, or in the middle of COVID. Yet the plans which we're putting in place will be to promote all of the relevant vaccines to all the right groups, as well as starting to get people engaged in the fact that there may possibly be a COVID vaccination program at the same time, maybe. So we're hoping we're going to get potentially the perfect storm, which will actually provide us with the perfect platform to boost all of our vaccinations in the relevant groups this year.
Okay, thank you. Councillor Nicholas.
I'm getting there with all these bits and pieces turning on and off. Yeah, I'm quite fascinated about the pneumovac, because pneumovac should be given at the same time as flu vax if their surgeries are picking it up correctly. So I don't see why there's a problem unless their records aren't very good. One thing I was going to ask about the flu vac figures, do those include those that are administered by private companies to their workforce?
No, they don't. Well, unless they're recorded through the GP systems. So the data which we've got, which we present, is the data that comes through both pharmacies and GPs. And if you've got private companies like some care homes who actually employ different vaccinations through Occy Health, if those individuals let their GPs know, then the GPs will record it on their system, but it's not a watertight system.
So big factories, manufacturers in the areas, you wouldn't necessarily have those figures for those workers that have been done. So
only if they fitted into the at-risk categories. So if those workers were over 65 or had a health condition which put them in the at-risk category, we would have that data. But the data you'll get reported doesn't include anybody who isn't in one of those categories.
Right. So there actually is probably a chunk of figures who are vaccinated under the company policies that we don't have the data for. So that was my one thing. And then I was really pleased to see on page 151 on 8.5 that you're picking up that air quality thing, and again the indoor air quality, and not just about smokers but the effect of bonfires. So I do think we really need to hammer that about getting this prevention of bonfires into the area, and given that this report now seems to be more southwest than just one particular county, I think that's really important that that's taken forward.
Okay, thank you, Councillor Nichols. Councillor Biscoe.
Chairman, this may seem like a trivial question, and it may seem a bit smart-assed as well, but underlying it is an interesting point about cross-referencing a set of strategic policy recommendations with actual activity. So I'm referring to paragraph 9.12 on page 153 of our numbering, 29 of the report. And it talks about all members to lead and support local action following the declaration of the climate change emergency. And I just wonder how the reference that we heard earlier on to drive through delivery points for flu vaccines and so on, and how how in future we intend to make sure that there is a degree of compliance between the delivery of health protection and the need to protect the environment and reduce our impact upon it. So how does a drive-through delivery point comply with paragraph 9.12?
I mean, clearly you've raised a very valid point there, Councillor, and it always comes up to this this question about priorities, doesn't it? And how we weigh up those priorities. If we want to do a mass vaccination programme, then potentially we need to find a different, and in a COVID-like situation, we need to find a safer way to do that in terms of health. And there may have to be some compromises. Now, clearly, if we are going to, and it hasn't been agreed that we will adopt the drive-through process, but clearly, if we do a drive-through process, there will be marketing and campaigning going around that, which we could try and encourage people not to turn up as a single car owner to get their vaccination, but to actually make most use of that. We would aim to have the vaccination, the drive-through sites within local areas, so that if people are going to use them, they haven't got to drive, a long distance to actually access them. But you're absolutely right. There is a conflict between those two issues, and I think that's part of one of the reasons why one of the recommendations from the Director of Public Health report is that we do consider all of the planetary and health needs alongside any policy and process decisions.
Okay, thank you, Ms. Golson. Councillor Lennox Boyd, please.
Good morning, Armin and everybody. Just a little update that I'd received an email a few weeks ago. We offered to the NHS our football club, the house and the grounds, and it was taken up by the NHS to vaccinate our children that were not being able to attend school. So that was one of the ways that I feel that they're catching up with the vaccination. Thank you.
Thank you. And that's good local leadership, Sheila. Making sure that people get their vaccines and using what facilities you have in your community.
Yeah, they offered it away to the NHS, and it's good to think that they've taken up, because you've got, with a football pitch, there's plenty of room and outside space for people as well.
Okay, thank you for that. Currently, I don't have anybody else on the list for speakers. I know that Councillor Pollard will come in and say that we should not note this report, we should welcome it. So I'll do that before he says that. Can we go to Miss Martin and have the recommendations? I'll propose it. That helps.
Hi. So in light of Councillor Pollard, I had preempted a change. So the wording would read that the findings of the health protection report be supported. Is that okay? And Councillor Toms as proposer. Can I have a seconder, please? Someone can voice there as a seconder.
Councillor Pollard, I think, will second it.
Councillor Pollard, could you just confirm that?
I will, yes, and just, yeah, happily. Okay.
Thank you very much.
Chairman, Bert Biscoe, could I suggest that as well as that, because there are priorities for this year set out in here, that we would support, accept the report and endorse the priorities for 2021.
Add that bit on the end, endorse priorities. Is that okay for you, Councillor Biscoe?
Happy.
And happy. Thank you.
Fantastic. So I have amended the recommendation as per that. So the recommendation would read, just for clarity, that the findings of the health and protection report be accepted and the priorities endorsed. Okay. Right, I will move to the vote on this one. So, Councillor Biscoe.
4.
Councillor Ellenbrook.
4.
Councillor Gammon.
4.
Councillor Jetkin.
4.
Councillor Kirkham.
4.
Councillor Lennox Boyd.
4.
Councillor Martin.
4.
Councillor Nicholas.
4.
Councillor Parsons. Councillor Parsons.
4 again. Can you hear me?
We can just about hear you, Councillor Parsons. I heard you say 4.
4. Definitely 4.
Fantastic. Thank you.
Okay.
Councillor Pollard.
4.
Councillor Thomas.
4.
Councillor Toms.
4.
Councillor Ver.
4.
Councillor Williams.
4.
Is 14 in favour and therefore it is carried. Thank you very much.
Okay, thank you, members. We'll go straight on to the next item, item 8 on your agenda, the COVID-19 Outbreak Monitoring Report. I'm not sure who's taking that report.
Councillor Toms, it's me again, Ruth Goldstein from Public Health.
Okay.
I'm sorry, you have to bear with me on this one as well. So hopefully everybody's had a chance to read our local outbreak management plan, which was contained in the report, which gives you an understanding of how we are monitoring and responding to the COVID situation currently. That document is live and the second iteration of it is due out in a week or so's time. We've been advised nationally that the lumps, as this is friendly called, is something that we should keep live and expect that we can add to as our experience of dealing with the outbreak increases. But within that report, there is the governance arrangements for local outbreak management, and also the information about the membership of the various directors and the boards which we have as part of that governance arrangement. There's also on page 187 structure there which explains how we actually are dealing with and monitoring outbreaks. So it starts essentially every morning with the outbreak assessment team having a meeting using the latest data that comes through from Public Health England and from local sources where we look at the cases and the outbreaks that we're aware of. And the idea of those meetings is that we try in Cornwall, while we've got relatively limited numbers, we try and understand how each case could have possibly contracted the virus, and also more importantly, that we've got some assurance of them being able to close down that recontainment and not being able to transfer it. It has to be said that the data coming into the local authorities since the beginning of the outbreak has improved considerably. I'm very glad to be able to report that, both in its timeliness and in its depth of information that we're now getting. So the two other pieces of information which I've attached to the report are the 5 tests that we look at each week, which related to the government's 5 tests that they wanted to assure themselves that the pandemic was heading in the right direction. And so we look at those 5 areas. So can the NHS cope? Is there a fall in death rate? Is the infection rate falling? Have we can we give assurance that currently there's adequate PPE in the system and the risk of a second peak? And we look at the data which we're getting to be able to support or otherwise those objectives, and we report that on a weekly basis. And then the other piece of information which we're reporting weekly is attached as a COVID summary to people, which is including our sort of confirmed cases, our confirmed deaths from COVID, where we sit across the southwest in terms of our cases per 100,000, where the deaths are, and we've also started now including some information about the testing that's been carried out across the council, as that is new data which we've just received. Obviously, behind both of those reports, we get data feeds which have got a lot more information in them, and now we are starting to get data feeds with personally identifiable data in it. And I'm pleased to be able to report that as of Monday, we are starting a process to contact every case and every contact that we are made aware of, so that we can ensure that the actions that are required from them have been carried out. And that will also include cases that haven't engaged nationally with the track and trace system, so that we can try and encourage them to engage with us, so that we can do that piece of work which is missing from the national system. We also have data which I can't really share in detail with everybody about our outbreaks, which thankfully at the moment are very limited. We've got currently three outbreaks in, we've got 3 active outbreaks in care homes and 1 active outbreak in a school setting. The term outbreak sounds very alarming. It makes it sound like, there are lots of people, but actually the definition we use for an outbreak is that it is 2 or more cases which can be linked in time or geography, or one case in what we would consider a vulnerable setting, which is why if it's a care home or a school, we consider that as an at-risk setting, and therefore we go in and we're supporting those settings individually to make sure that all the right containment issues are being addressed, and that they're following the Public Health England guidance, and we work alongside our South West Public Health England colleagues when we have outbreaks. Now I can talk ad infinitum about our outbreak management and our monitoring. I thought that would hopefully give you a bit of an understanding of where we are, and I'm very happy to take questions.
Okay, thank you. The first questions from Councillor Kirkham.
Hello, sorry, I got in quick again. Yes, you kind of anticipated my question because I put the question in the box before I heard you talking about the contacts. It's really good news that we're getting more information. And you said we would now get names, I think you said, for every case and every contact of that case, even if National Test and Trace hadn't managed to contact them. I've just checked that that's right for both of those things, people who've actually got or tested positive and their contacts, because that's really helpful. In the report on page 197, it says that the pillar 2 tests can take up to 72 hours to get the results, and that still seems like an awfully long time, and I wondered if that was still the case now. I was going to ask about the pillar 1 testing. I think we just have 3 Marston to do that. Is there any possibility that we could expand our capacity to test ourselves? And I had a question about, yes, now the restrictions have come in on people isolating when they come back from abroad. Are we doing anything? Do we have any responsibility to monitor people, say, who are coming through Newquay Airport? Are we able, or are we supposed to be doing anything about that? And I had a question on care homes, which I think I will raise now, even though it comes up in the next item, because there are still about a third of care homes who aren't paying sick pay when people are having to isolate. I was going to ask if we have contracts with those care homes and if we are able to do anything about that.
Okay, so shall I take, is it okay if I answer those now, Councillor Toms?
Yes.
Okay, so in terms of contact, so we now get a daily list of, which has got the name and contact number of every case in Cornwall, and thankfully those numbers are very manageable. So our plan as of Monday is that they will each receive a telephone call, and that is even if they have given all their contacts details to the National Track and Trace. We are still going to contact them and try and follow up and just try and have those local conversations to make sure that that contact tracing has been as comprehensive. One of the bits of data which we're missing currently from the national system, because people don't report it, is their work settings. So that's one of the key things we want to make sure that we're getting. In terms of contact tracing, so actually tracing the contacts of people, again, we're starting to, we get telephone numbers of anybody who has engaged, and I think it's the name as well, of anybody who has engaged in the contact tracing process. So if you're a contact and you've confirmed that you are prepared to self-isolate, then we will get your details. And again, we're keen to contact those people to make sure that they don't need any care from us while they're self-isolating. We've got a great voluntary sector system set up now to deliver food and medicines, etc. So we want to make sure whether that's needed. People who have the cases whose contacts haven't engaged, we will also know, because by their name in our line list there is a space where they haven't given contact details of contacts. So we will pick those people up when we're talking to the cases, just to make sure that either they don't think there are any relevant contacts, or if their contacts haven't engaged, whether we can work with the case to try and get those contacts to engage.
Brilliant.
So that's what we're aiming to do. It's a system which we're going to start, we're probably going to start piloting it tomorrow and Friday, with the idea that it will go properly live on Monday. We need to understand the resource implications of that, and we've got some resource in place for it currently, and we'll be monitoring that really carefully to see whether we need to bring in additional resource. We have funding if we do, and we've got a list of people who have notified us that they would be interested in supporting us. So if we do need additional support for this, and if our numbers do start to increase, then I would certainly be looking to do that. But so I'm really happy right this minute that what we've been asking for the last, I don't know, 12 weeks, we've actually finally got, and we're in a position to be able to do something. And evidence from places like Leicester and Blackburn, who have been trialling this kind of process, is demonstrating that it is providing a lot more local information and getting much more granular, which is kind of what we need, definitely.
Yeah.
Your question about Pillar 2 test taking 72 hours, at the time we wrote the LOMP, that was what they were guaranteeing, that you would have results within 72 hours. I know people have had experiences from earlier on in the testing process, which meant they waited for a week or so, which was clearly unacceptable. Now we are actually getting our reports back, and when we see data, it talks about when they had a test done, and then we're given their results. Often that was within 24 hours now. Not every time, but often it's within 24 hours. So that's much more encouraging. So 72 hours, I think, is what their outside level should be, but they're certainly coming through a lot quicker than that. And I think there is some hope that there will in the future be even quicker testing than that, which will be useful. In terms of Pillar 1, as far as I'm aware, there are currently no plans to expand our Pillar 1 testing sites, but because I don't think people have identified that there is a problem with that, but I can certainly go back to our testing lead, Claire Higdon, and raise that with her. I can't really say any more about that. In terms of monitoring at Newquay Airport, I know our sort of community safety staff have been there over the weekend and will continue to be there to meet the flights from Spain, just in case people are clearly distraught about the fact that they went on holiday and now are coming back and being told they have to self-isolate. So to try and help manage that situation, we have no power at the moment to enforce that, and we also have no power to monitor it as such, but we want to make sure that everybody gets the right information of what they need. In terms of the care home and sick pay, I'm probably not the best person to answer that, and I don't know whether Helen Charlesworth may still be on the line or not. But we can certainly...
Thank you. I am, and I can. So we are working with care homes as a matter of routine. So there is a working group specifically dealing with care homes. I will pick up your query about a third of care homes because, as you may be aware, the government has made available a grant to care homes. The grant
is payable under certain conditions, and in order to receive the grant, the care homes must comply with those conditions. They have all certified, sorry, let me rephrase that. Those that have accepted the grant have all certified that they're complying with the conditions. So if you have specific queries about specific homes, if you could let us have those, and we'll take those back and make sure that the care homes that have accepted the grant are complying with those conditions.
Okay, thank you. Just a reminder that to members just not to.
So, Armin, am I able just to come back very quickly?
Very, very quickly.
Yes, sorry, Helen. I got that figure from, it's the every 2 weeks the care home assurance report that we put out. It was a one that was 2 or 3 weeks ago, but that's where that figure came from. So I'm not sure which specific care homes it referred to.
That's fine. I'm not familiar with the detail of that, but I'll pick it up with the team, so you don't need to do anything.
Okay, thank you.
Just a reminder, members, not to try and repeat what others have said, just to make sure that we get through the meeting as fast as we can, because there's still a number of items to come through. Councillor Martin is the next one on my list. Thank you, Colin.
Thank you, Chair. So if I could just ask people to look at page 184, it's page 7 of the local outbreak management plan. There's lots of really positive stuff in there, very aspirational. We will adopt a continuous learning approach to the planning and response. We will ensure that there is an integrated data and surveillance system established. We will propose, or we are proposing, that a COVID-19 regional data and intelligence framework is developed. And I'm just trying to figure out how much of that proposal and aspiration is actually reality. So it's good, Ruth, to hear you saying that you're meeting daily to look at the latest data, but how latest is the latest data? So you said from Monday we're now contacting every case, which is brilliant. Of course, we did ask in March whether Cornwall Council's public health team should be able to do that. And it's taken now until the end of July for you to actually be given the information to make that possible. In which time there've been 920 cases. So when you had your meeting this morning and you were told about the latest cases, how many days ago did those people actually first report having symptoms and try to get a test? Because I'm trying to work out whether you're sort of getting hold of people the same day or whether it's a few days behind. And that I think relates to what Councillor Kirkham was saying. I don't think she was saying expanding Pillar 1 because we need more capacity for health and care staff to be tested. I think what she was perhaps getting at is if the turnaround time between someone trying to book a test, then finding that the public testing site already closed an hour ago for today, and so they've got to wait until tomorrow or drive all the way to Plymouth. So it's actually going to be tomorrow when they get tested, and then 24 to 48 hours after that the result is known nationally, and then a certain amount of time after that before it's passed on to your team locally. It's not about should we expand Pillar 1 for more of the local healthcare staff. It's about saying, could we use our own Cornwall testing facilities, and perhaps even some of your, I know we've talked before about actually some of Cornwall Council's public health staff having test kits in their cars, so when someone rings up to say, I think I've got some symptoms, that one of your team can go straight to them and give them a test and get that taken to a local lab straight away. The key thing there is, what would the turnaround time be if someone rang Cornwall Council and said, can we get tested through the local facilities? And how does that compare with the total time for booking a test on the national system, the time taken, it might be the next day for them to get a slot. How long does it take to come back? How long does that take to come to you? And therefore, should we be considering doing more on our own? The vulnerable settings, I was a bit unclear on this on the briefing, and I'm still not quite sure now. Okay, so schools and care homes are considered to be vulnerable settings. Are hotels and campsites considered to be vulnerable settings? And if someone is on holiday in Cornwall, the testing and tracing, the COVID testing website where you book your test doesn't actually ask you where you're staying. It just asks your home address. So if someone from outside Cornwall is sick today with symptoms in a hotel in Cornwall, how long does it take for the system to twig that they're in a hotel in Cornwall rather than just being registered as a positive case in Birmingham or Berkshire or Blackburn?
Okay, can I start to answer those questions then, if that's okay? Yeah. So your question about how latest data is the latest data. So we've now got our own data analysis system. So you're right, what was written in the LOMP on the page you referred to were our aspirations, and we are making those aspirations a reality as I speak. So we have our own data collection and recording integrated system set up now, which allows us to put on cases and outbreaks and track them throughout, and we can link that data up. So if we have a address, a postcode today, we can then do a mapping of postcodes for the last, 12 weeks, 16 weeks, if you like, so we can see if there is any historical or any current clustering going on, and that is exactly the kind of work that our analyst team are doing. So I have confidence that we are able to track what's happening today, but also do a look back however far we want to, because our data system has got all the information that we've had right from the beginning. On it. Now, although at the beginning we weren't getting full postcodes, we had some information which would give us some indication, and since we have had full postcodes, they're all on there. So the data system which we were aspiring to in our LOMP is now a reality. It's not as refined as we want it to be. We want to be able to pick up much more instantly settings, and like you're saying, things like hotels and campsites, we want to be able to record. So we're constantly reinventing it and giving the people who are writing it more challenges so that it becomes more what we need. But it's certainly at the moment giving us far more insight and the ability to look back. You talked about the time lag from symptoms to test to us knowing. So we're getting reports now which are giving us an indication of when somebody first had a symptom, when they then got tested, and when we get the result. We're getting these daily records now from Public Health England of our cases, and they are reporting cases within the last 24 hours to us generally. Sometimes it is 48 hours, I can't deny that. And generally those people have had the test done on the day their symptoms started. Not everybody, but occasionally. So I would say that if I had to give you a maximum length of time, I would say that 99% of them are coming through at a maximum of 4 days since that first symptom. At an average, I would say it's probably 24 to 48 hours since that first symptom. It is, I can't tell you how much better the system is. I know you had a very poor experience, and we've talked about, the lack of data and the lack of transparency and the turnaround times. We've constantly been feeding that back up to Public Health England and the NHS through all of our links, and the system is so much better than it was. It's not perfect, and there is always going to be something to improve, but we are certainly getting much more data. Your information about the vulnerable settings and tourists that you're asking about, that is something which is in the process of being sorted out. So locally what we've done, because at the moment you can still only record one address when you go and have a test. So we've been putting pressure on the testing system so that they will ask people for their current address and their permanent address. Now, they have given us a commitment that they are looking into doing that. They don't see why it's a problem, but I know it's still not there. Although, having said that, I did get somebody through the day before, who did have 2 addresses. So there must be a way to do it, but it's not commonly known. So what we've done in Cornwall and the Isles of Scilly is send out communications to all of our tourist sites and hospitality industries and campsites and bed and breakfast and everybody, posters of information for for their visitors to say, if you get a test while in Cornwall, please put your holiday address on the notification, so that we will at least know that that person is in Cornwall. Now, it's not perfect, and we're working with Public Health England to get that perfect solution, and with the testing people. But at the moment, that's as much as we can actually do to make sure we do get that information from them.
Right, thank you. So at the moment, the website only asks for one address. The website doesn't tell people to use the place they're staying. It just asks them their home address, effectively. We're 2 weeks into the summer holidays, and people are coming to Cornwall, and if they put their home address, then they will show up on whatever their home council, their local outbreak management team will pick them up, and we don't know how long it will be before that feeds through to you down here in Cornwall.
Sorry, can I just come in there? The thing that we do know is that if that person then gives contact details of where they've been in Cornwall and people that they've had close contact with, that will come up within our contact listing. So the contacts for that person will be recorded within Cornwall if they are Cornwall addresses that are necessary.
But rather than as soon as the result comes up positive, that automatically showing up as a Cornwall case, it's then 24 hours later when the national Serco testing and tracing team have got hold of them on the phone and asked them where they were, and then they've said, oh, I was on holiday in Cornwall, then that information is going to get through to you. And I don't think that you said hotels are treated as vulnerable sites. So one case in a hotel doesn't count as an outbreak, like one case in a care home or one case in a school. Is that right?
No, so sorry, I haven't got to that bit. In terms of our response, so we're having a specific response packs and response teams for what we consider to be vulnerable settings and vulnerable locations. And certainly in terms of our responses, we have a complete response pack which we will enact if we recognise that there is a case within a campsite or within a hotel. Yes, and we're using this sort of GIS information that we can have on our system so that we can identify those, definitely the bigger sites.
The very last thing then is someone who is a teacher at the school where there was an outbreak the other day, did not have any symptoms herself, but was given a test, which I thought was brilliant, because we've been saying for weeks and weeks that people who are known contacts, even if they don't have symptoms, ought to get tested. But so far, the government website seems to still say that people only get tested if they've got symptoms. Can you clarify?
The general advice is it's only for people who've got symptoms, and that is because the test is only valid on that moment that you take it. So you may not, if you test negative, if you're a contact of somebody, we need you to self-isolate no matter what, symptoms or no symptoms. The only reason to have a test if you're a contact is so that you could come out of isolation quicker, because if you do test positive, you only have to isolate for 7 days from the first symptom, whereas if you're a contact and you don't test positive at all, then you have to isolate for 14 days. So that is the only time when it is relevant to test contacts.
Or if you test positive and then it turns out that then all your contacts need to then isolate as well, and that's how we stop it propagating down the chain. So, but what I'm saying is, someone without symptoms at that school did get given a test. Is that the policy, or was that not the way we're doing it?
That's not the advice that I believe that Test and Trace are giving out at the moment. The national policy is still that you only get tested if you've got symptoms.
Okay, so still not clear. Thank you. You're doing a wonderful job in very difficult circumstances, and the criticisms are all aimed higher up, but thank you very much.
No worries, thank you.
Right, Councillor Jenkins.
Thank you. Well, Councillor Martin, in his typical form, has covered most of the questions that I was going to ask, and got the answers that I expected. Can I just tease out a little bit more on access to tests? Because if you are on holiday in Cornwall and you ring 111 with symptoms and then you are told to get a test, will the 111 system direct that holiday maker to the most appropriate test centre, bearing in mind that we don't have a lot of access to tests in Cornwall? And in terms of access to tests, I share Colin's frustration really in terms of why can't we get them more accessible? Why, I heard something about the government proposing to phase out home tests and booking them for home, but that seems to be the only way that a lot of people in Cornwall can get access to tests. Otherwise, you have to drive quite a long way in a lot of situations to get to a test centre. So are we putting pressure on anyone to give us or GP surgeries or whoever access to tests? And similarly with the weekly testing in care homes, how is that being managed so that we ensure that people have access to the tests in a timely manner? Because my concern is that if the only way to access a test is by booking it online, that might take a day. And then if you've got to wait for a home test to come, that might be another day, and then a couple of days to get, it doesn't take very long to get up to 5 days before the result is known, let alone you getting the information back, which obviously in terms of a local outbreak is too long to nip it in the bud. So can we get some better access to tests in Cornwall? We don't have a regional test centre at all in Cornwall.
No, we don't have a regional test centre in Cornwall. What we do have is 4 mobile units that are moving around the county at regularity to make sure that people do have as much access as possible. There have been occasions where we have heard of people having difficulties in accessing tests in a timely manner. When we know that, we do work with our colleagues who run the Pillar 1 testing site, and they do have a man with a van, and we have employed that for certain groups of our population where we felt that's absolutely necessary. So we can do that. We don't have that systematically in place at the moment. There is a testing strategy and sort of development plan being written at the moment across the southwest, but we're having our own version for Cornwall and the Isles of Scilly. So I can certainly raise that with again Claire Higdon, who's managing it, and just find out if there are any plans to use our local resources any more than they are currently being used. In terms of your question about access for holidaymakers, will they be directed to the nearest test, or will they be told to wait till they get home? I understand that they will be directed to the nearest test, providing they let somebody know when they're actually trying to book it where they actually are. So again, the system isn't perfect, and I can't guarantee that the system is perfect. But if you are on holiday in Cornwall and you request a test, then you should be directed to one of our mobile units or to request a postal kit.
Just to come back on that, Armand, I really think as a committee we should be encouraging the expansion of local provision of tests. And if there is a man with a van, can we get 2 men with 2 vans, or even a woman with a van going out? Because we are in a very dispersed population and we don't have easy access, even by driving, to regular test centres. So perhaps that's something that we could look at as a committee.
We can do that. Okay, the next one on is Councillor Parsons. David.
Thank you, Armand. One question about data. On page 220 of the report, you've got a cumulative hospital deaths graph, which makes no mention of North Devon whatsoever, as usual. And I'm just wondering whether that means there were no deaths in North Devon from Cornwall, or whether they just haven't reported it, or whether nobody's actually thought to put it on the graph, because there's a significant amount of people who will be going from here to North Devon unwell, and if we're not getting the data, that's not really very helpful. The second point I'd make is I just wonder if if I brought my family down and spent an awful lot of money on accommodation, if I felt vaguely unwell, would I be immediately calling for a test, or would I be taking 2 paracetamol and waiting 2 or 3 days to see if I felt better or no? Because the problem with this is that there isn't a sort of clearly defined set of symptoms that you can pin down and say, I've got COVID and I need to do something about it. So I just wonder whether anyone's seeing any evidence of a slightly slower uptake, shall we say, of testing before people get quite ill when they're on holiday. The reason I ask is that this is a very mobile population. They move in and they move out sometimes within 3 or 4 days. And if they're coming in, they're sort of soldiering on and then going home. It makes it very difficult to track things. Thank you.
Okay, if I can answer the deaths question first then for you, Councillor. So the death data which we have overall is for all deaths where somebody has got a Cornish address. So if somebody is based in one of the hospitals outside of our county, but they do die of COVID, then they will be reported in our deaths list. The graph that you're referring to on page 220, which has only got the cumulative hospital deaths from CFT, RCHT or UHP. Yes, you're right, they're not included in that, but they are included in our overall numbers, and I can certainly take that back to our data analysts as a query of whether we need to expand that or not. So your question about tourists, you're absolutely right. You know, are people on holiday going to get themselves tested if they're here for a weekend and they just feel a bit unwell? What we're trying to do all the time is promote the other parts of the public health messaging. So the social distancing, the regular hand hygiene, the wearing of the face masks in places that are crowded and on public transport. We're pushing through the media constantly information and advice to say, if you go to a beach and it's really busy, go to another one. Because actually, if people maintain social distance from others, then even if somebody is walking around symptomatic and they're not so ill that they need to be at home, the likelihood is it won't be transferred. It will only be transferred if you break those social distancing guidance. So that's why it's so important. While we can't monitor everybody every day to make sure that everybody hasn't got COVID, that we keep pushing forward those public health messages, which are really dull and everyone's getting really tired of hearing, but they are absolutely our weapon to fighting this. Testing is not our weapon to fighting it. The public health advice is the weapon to fighting it, for precisely the reasons you've highlighted.
Thank you for that. I think social distancing is an interesting concept if you live in a holiday town, I have to say. Can I just go on about this graph business, because it constantly happens that the people from this end of the county say, but they're not taking any notice of us. Now, you may be getting the data, but in this official report, it's not recorded. And I think it's really important that the North Devon statistics are in there, because if they're not, people think they're not being taken account of.
Yes, I will certainly be passing that on to my analyst team.
Thank you.
Okay, thank you. I have no further questions. Let's go to the recommendations.
Sorry, Armand, I beg your pardon. Could I ask a very quick question?
Yeah.
I'm really sorry. Thank you. On page 204, you've got a breakdown of the various people, and you're talking about vulnerable individuals and groups. What my question is really is the group that were shielded, particularly those who had letters saying that they should shield, because certainly at the beginning there was quite a lot of confusion about who was on the shielding list and who wasn't on the shielding list. For example, my husband actually had 3 separate letters about it. I suppose 3 being better than none. But do you now have an accurate list of those people who do have these very problematic underlying health conditions, which is, and as I say, the important point being, which is accurate?
So we have a whole group of people who have been working on the shielding work to precisely get that one list of accurate addresses and names so that we can work with that community. I can't remember right this minute the number of people on that list, but I know that it has been compiled through the GP data, through the secondary care data, and through the national shielding list, and it's been cleaned up to make sure that we don't have duplicates, and that we do have possible people or anybody who's been given a shielded letter from any of the possible avenues. And I think it's about 26,000 people in Cornwall, but I don't quote me on that because I'm not entirely convinced that's right. So those people, whilst they're not classed in, and this was set up before, this is one of the amendments we need to make. We have identified that if we do end up with any kind of community outbreaks, or any sizable outbreaks which could have an impact on the shielding community, they will need a special set of communications to be sent specifically to them in a way that they can all receive. And so within all of our incident response teams, whether it's within a work setting or whether it's in a tourist setting or whether it's in a care home, we're asking the response teams to consider how they would want to communicate with people who've been in that shielding category, what they would want to communicate and how they would access that. So shielding community will be embedded within all of our responses, no matter where it is. But we will be using that one list that the council has now compiled from all these different sources.
Thank you very much.
Okay, I have no further questions. Looking at the recommendation on page 173, that the Health and Adult Social Care Overview and Scrutiny Committee, and note, I will change that to welcome the progress made by the Cornwall facility to establish the comprehensive and timely COVID outbreak management response, and then add on the end and consider the comments made by HASCOS during this debate.
I think Leanne wants to come in for a moment, and then I'd like to say something.
Okay. Yeah.
So mine was just to make the committee aware that there was the proposal from Colin Martin that was in the box.
Thank you, Leanne. So what I would like to suggest is that we condemn the delays and gaps in the data given to Cornwall by central government since the start of the outbreak, that we commend the efforts of the Cornwall and Isles of Scilly teams to put together an outbreak management plan in spite of that missing data. We welcome the progress now being made. We urge the government to fix the remaining, to close the remaining gaps. And finally, given that it's only this week that the team have actually got the most the actual personal contact details, is that we ask them to come back with a further report to our next meeting, or perhaps briefings in the meantime, to tell us what they're learning from the direct contacts that they're finally able to have with people who've been tested positive for COVID.
Okay, I did see somebody second that proposal. Was Councillor Jenkins. Leanne, you wanted to come in, and then Councillor Nichols.
Yeah, so just for the purpose of the any members of the public that are listening to the stream, my understanding is the proposal has come from Councillor Martin. Councillor Jenkins has seconded that proposal for what is it? So 5 recommendations if we separate them out.
Yep, I'll email them through to you. Condemn the delays, commend the local efforts, welcome the progress, urge the government to close the gaps, and ask for further updates to come to this committee in due course.
Yeah.
Okay. Before we go to the vote, Councillor Nicholas wanted to come in.
Yes.
Yeah, thank you. the fact that the government are delaying, and they don't delay things on purpose, Councillor Martin, it's what information they get. So I'm not going to be agreeing to anything that's just a political game. Thank you.
Okay, so to clarify, I'm not condemning the government for it taking 48 hours for data to get through now. I'm talking about the delay between March and July for Cornwall Council Public Health Team to actually have contact details of people. We know 923 people have contacted the government to get tested, and it's only this week that Cornwall Council is actually getting their contact details to call them. So I appreciate, people might not all want to agree with the recommendations, but that's what I'm proposing.
Okay. Leah.
Okay. Councillor Nicholas, did you have an alternative proposal?
Well, given that everybody was dealing with a new outbreak, an epidemic that it became pandemic in the early days, then obviously people weren't absolutely on the ball with it. So I don't think that should be part of it. I think everybody has worked extremely hard in the circumstances, and I think that should be reflected in those proposals.
Okay, so is that an amendment? You're proposing removing that first line of my proposal?
Yes, I am.
Okay.
Do you have a seconder for that?
Yeah.
Do we have a seconder for that?
Chair, I wonder if I could come in as seconder of the original proposal at some point.
Yeah. Councillor Biscoe.
Chairman, it seems to me that in any circumstances other than the French Revolution and a sort of an insurrection, that using the word condemn is a bit harsh.
Absolutely.
I certainly think that I have some sympathy with what Councillor Nicholas has said. The government was in a position where no government has had to handle the situation that they were in, and they were feeling their way forward. And hindsight is a wonderful critic. It seems to me that it is regrettable that there was a delay, the delay that Councillor Martin is referring to. And I think if Councillor Martin would amend the word condemn to the word regrets, then I suspect a great deal more people would support the very worthy other elements of his proposition. I think it's the word condemn which is the problem. So I would make the amendment that we retain his proposition, but we remove the word condemn and express our regrets that was the case.
Thank you, Bert. I'm happy with that.
Thank you. We did, when we spoke last on the 11th of March, Public Health England did know the contact details of 5 people in Cornwall with COVID and chose not to share them with the Public Health team. So I will stick with condemn. Obviously, if people choose to amend it, then that's the way the process works.
Mm-hmm. I do have a seconder for Councillor Nichols' proposal, and I have a seconder for Councillor Biscoe's proposal to remove condemned and replace it with regret. I think there is a medium way here. Councillor Jenkins.
Yes, I wanted to come in as seconder of the original proposal. I agree that condemn is a strong word, but as Councillor Martin has said, on page 4 of our minutes, of the minutes of the last meeting, we were already on March the 11th expressing concern that we weren't going to receive the data at a suitable level. And the council has been asking since then to get the data at a suitable level. It's not like the data didn't exist. It was a choice of, Public Health England not to give the data at the appropriate level to the local authorities. And it's not just Cornwall who's had this issue. I think virtually every local authority, public health department have been expressing concern on the lack of availability of data in a timely manner and at the right granularity. I believe I heard Matt Hancock talking about the importance of granularity at one point, but we still didn't get the data. So personally, I do condemn the government for this, and I regret that they weren't able to trust their local authority partners with the data that was required for us to operate more effectively over the last few months. But I condemn that they felt that they were unable to do that. If that falls, I still regret. But I think we should stay with the original proposal and see what the situation is.
Okay. I have a number of people that want to come back in. Councillor Pollard and then Councillor Parsons.
Thank you, Armand. And I do fear that we're getting into a bit of a tit-tat for tat here about, with Sue trying to defend the government, which entirely is her right. I just feel very strongly that condemn is too harsh a word. They did have very difficult decisions to make. We, as you know, regretted greatly that they wouldn't give the public details of where incidents were in Cornwall. And that's still the case. And I think, we can question these decisions, but I don't condemn them for it. But I certainly regret it, which is why I support Bert Biscoe's second amendment.
Okay, thank you, Councillor Pollard. Councillor Parsons, quick one, please.
Yes, I agree with Councillor Pollard on this. I do think condemn is a very strong word, and I think when we get to the point of having a proper inquiry into this, which I hope will be fairly soon, then you might have evidence to condemn. At the moment, I think regret is an appropriate phrase and will probably get more support and more people taking notice of it. So I should be supporting the amendment to change condemn to regret.
Okay, thank you, Councillor Parsons. No further speakers. Sorry, Miss Martin.
It's all right, don't worry. So it feels to me that it's recommendation 1 that is causing the concern rather than the others. And therefore my proposal is that we have a vote on recommendation 1 and then a vote on the rest of the recommendations, because it feels that the recommendation 1 is where there is a change or a difference in opinion. So we would go with the first proposal, which is Councillor Martin, seconded by Councillor Junkin, which is that, just double check, that condemn the delay in the gaps in the data provided to the local authority. Let me just get that. So if are members happy that we then move that, and if that fails, we then move to the second proposal?
Before you go into that, Councillor Biscoe wanted to.
Well, I just a bit of a point of order, I think. I understood that what we had was a proposal and 2 amendments. Correct me if I'm wrong, but you put an amendment before you put the proposal.
Agreed, Bert, in the order of the amendments. So the last amendment should go first. In my view.
Agreed.
Yeah, that's fine. So that the amendment proposed by Councillor Biscoe and Councillor Pollard is that in the recommendation that the word condemned is changed to the word regret. So it would be regrettable that the delay in gaps in the data to the local authority.
Yeah.
I think that I need to propose everything that Councillor Martin proposed.
Yeah.
With the alteration in the word, and I believe it should be that either this committee or Cornwall Council regrets.
Yeah, I think you're just proposing changing that one word, and then depending on the outcome of that vote, then my original proposal stands.
Yeah, but in order to keep your proposal alive, your proposal has to form part of my amendment, because it's your proposal I'm amending. So it is the whole proposal with the one word amended. That's the point.
Okay. So if we're voting for, that is for the word regret, and if we're voting against, that is to keep the word condemn.
Yes.
Councillor Gammon, you just indicated you wish to say something. Be very quick, please.
Yes, I'm sorry. I can't. I'm struggling to be able to vote for either of those words. One is too strong and the other one is too weak. The other one is not going to have any kind of impact whatsoever.
Then that is your choice, Councillor Gammon. Right, Miss Martin, please.
Thank you. So, are members content that they are currently voting for that the committee regrets the delay in the gaps in the data being provided to the local authority, commends that the Cornwall and Isles of Scilly teams Cornwall and Isles of Scilly just in the spite.
Sorry, this is confusing because now it sounds like if I'm voting against all 5 of my own proposals. So surely we're just voting on the amendment to amend the word condemn to the word regret. Do we condemn the delay in the data provided by the government to Cornwall Council, or do we regret the delay in the data provided by the government to Cornwall Council? And then once we know whether it's condemn or regret, then we can have a second vote on all 5 recommendations when we know what they say.
Okay, right. So the initial proposal and the amendment. So the amendment is that the committee regrets the delay in gaps from the government data to the local authority. Is that correct?
The delay and gaps in the data from the government to the local authority.
So,
yeah.
Could I just point out, Chairman, I'm sorry to do this, but if the amendment is passed, then that would supersede the proposal. That would be what was passed. So therefore, the amendment, I have no objection to anything but the use of the word condemn. The amendment needs to include the whole of the proposal so that if it goes through, if it's won, the whole of the proposal will be won. If we simply amend one clause of the whole proposal and the amendment stands, we won't go to a vote on the original proposal because the amendment will have superseded it. So therefore, it is important that the amendment includes the whole of the proposition. I mean, I don't want to. I'm not arguing about who owns the proposition or anything like that. I just want to get something through the committee because I think it's an exceptionally worthwhile. Now, the alternative is for Councillor Martin to actually reconsider his use of the word condemn.
No, that's fine. Just as long as we're clear, if we vote against this amendment, then we subsequently have a vote on the unamended set of proposals that would come next. And you're saying if your amendment is approved, we don't need the second vote.
Yeah.
Therefore, to clarify, the rest of the amendment is the proposal. After that one, whether it's regret or condemn the delay and gaps in data from central government since March, is to commend the efforts of Cornwall and the Isles of Scilly's public health teams and health system in doing their best in the absence of that data, to welcome the progress now being made on the data being provided, to urge the government to close the remaining gaps in this data, and to request further updates to this committee in due course.
Ms. Martin, please go to the vote.
Okay. So we've split it out. So it's one. Okay. So the amendment is to the first recommendation, and it is that it is regrettable the delay in and gaps in data from the local authority from central government. So I am going to go to the vote on that. So Councillor Biscoe.
4.
Councillor Ellenbrook.
4.
Councillor Gammon.
Against.
Councillor Jenkin.
Against.
Councillor Lennox Boyd.
For.
Councillor Martin.
Against.
Councillor Nicholas.
For.
Councillor Parsons.
For.
Councillor Pollard.
Councillor Pollard?
Yeah, I was waiting for my call, but I do think that the wording needs tweaking. This is not regrettable. It is that we regret what's happened, frankly, but I'll vote for.
Okay. Councillor Thomas.
Yeah, for.
The Toms.
For.
Williams.
For.
Councillor Kirkham and Councillor Burr have left the meeting. And therefore, it's 8 in favour with 3 against and 0 abstentions.
Okay, thank you for that, Ms Martin. We'll move straight on to item 9, health and social care.
We need to take the rest of the recommendations.
We need a substantive motion, surely.
Yeah.
Okay.
Yeah.
Go to the substantive motion.
Well, I would propose we take all of them together.
Yeah,
now.
that's the rest of them be taken as one.
Hold on, but can we just be sure that the wording is not that it is regrettable, but that we regret that has happened.
I agree with that, Chairman. That is what I proposed.
Yeah.
Okay, we'll go with that proposal. Ms.
Okay,
Martin.
so the substantive motion, let me just... So you are voting on the other 4 recommendations in one lot. So the substantive motion, so Councillor Biscoe.
For.
Councillor Ellenbrook.
For.
Councillor Gammon. Councillor Gammon.
Go on.
I'll come back to Councillor Gammon. Councillor Jenkin.
For.
Councillor Lennox Boyd.
For.
Councillor Martin.
I'm voting in favour of all 5 recommendations as amended by the previous amendment.
Councillor Nicholas.
For.
Councillor Parsons.
For.
Councillor Pollard.
For.
Councillor Thomas.
For.
Councillor Toms.
For.
Councillor Williams.
For.
Councillor Gammon.
Sorry, I got kicked out.
Are you voting?
My internet plays up, sorry.
Oh no. For, against or abstaining?
For what?
The
Sorry,
substantive motion.
I was sat here looking at a blank screen.
So this is the substantive motion.
Which is, sorry.
All 5 of the recommendations that I made before, but with the word condemn changed to regret.
Regret.
I'm going to abstain because I can't agree to regret because I don't think it is regrettable.
Okay. So the vote in favour was 11 with 1 abstention, so it's carried.
Okay, thank you, Ms Martin. We'll go straight on to the item 9, which is the health and social care response to COVID-19. Is this Ms Charlesworth, Mayor?
Good afternoon, councillors. So I will be very brief because I am conscious of the time. What this paper is intended to do is make public all the confidential briefings that we gave committee members during the period of the pandemic, so that we can go on the record with the substantive information about changes that were made during the period of the pandemic, and enable you to ask your questions again in public. I won't say any more than that. Any questions will be fielded by myself, Kate Shields, Adrian Flynn, Tracy Lee and Ruth. Thank you very much.
Okay. Firstly, thank you, Ms Charlesworth. You know, the briefings were absolutely key to our understanding of what was going on. I have one question so far from Councillor Parsons.
Page 235, same graph, same objection. It just implies that you don't take any notice of what goes on up this end. Thank you.
Thank you. You're an advocate for the North East, that's for sure, Councillor Parsons. Councillor Jenkins, please.
Thank you. Councillor Kirkham, who's had to leave, actually asked in the chat box one of the same questions that I was going to ask, which was about the consideration for the reopening of day centres and also access for people who are using their own personal assistance for PPE. Those are two concerns that I have as well about how we're managing that. And so I wonder whether that could be answered. And also, within all the data, we don't really talk about excess deaths in Cornwall, and that's a piece of data that I've been asking for on a number of occasions, because I think we ought to be showing what we consider to be the excess deaths. I don't know whether it's because we can't determine a good 5-year average or not. Okay.
Yes, Ms. Ellsworth May, do you want to?
Yes, so day centres continue to remain closed. We are keeping a watching brief on them because we do want to reopen them, but we need to do that in a way that is safe and meets the needs of the people who use them. So we've got a watching brief on that at the moment, and we will update you when we plan to do that. At the moment, it is in the best interests of people who use those day centres for them to remain closed. They are very vulnerable and part of the shielding cohort in most circumstances. Obviously, rules around people who are shielding are changing at the moment, but we will update you when we have done a reconsideration. In terms of PPE to people with direct payments and personal assistance, throughout the pandemic, our access team have been phoning round people that we're not seeing routinely in a way that we would have done. So that's people who use day centres, but also people with direct payments. Now, we did have some feedback early on in the pandemic that those calls were not as helpful or productive as they needed to be. So we did make changes, but we have been phoning out and we have provided PPE to people with personal assistance and others where that's been necessary. So I can assure you on that. In terms of excess deaths, we do have that information. And I'm sorry it's not included here, but we can provide that.
Okay.
Thank you.
Ms. Shields, you had that information at your fingertips, I believe.
So the last time we looked from an RCHT perspective in terms of excess deaths, we don't look to be having excess deaths at the moment because other than COVID, of course, which were deaths that we weren't expecting. But what we are starting to see is a backlog of people who've waited an awfully long time to be treated. So we now have 2,000 people on a surgical waiting list who have been deemed to be at risk of limb loss, life loss, or irreparable damage. And as we work through those patients, we may find that people have suffered significant harm as part of waiting for accessing care. And we're hoping that we won't see that people have lost their lives or suffered irreparable damage through waiting to access care. But it is something that as a county, we are actively working with. And it will not just be our surgical patients, it will also be our medical patients that are in some parts harder to identify. But we're putting processes in place so that we can do that too.
Can I just come back and say I'd like to see a graph of the whole period of excess deaths, both due to COVID and other unexplained excess deaths, because that's a good way of monitoring it.
Yeah, Councillor Jenkins, I can confirm that we do have the information and that we do know that excess deaths ran ahead of our 5-year average, and we will share that information. It's not secret. I'm not sure why it's not in the papers, but we can provide that information.
Thank you.
Thank you very much. Next one is Councillor Ellenbrook.
Thank you very much, Chair. I've got a couple of questions that have actually been put to me in my role as Cornwall Council representative on the Carers Partnership Board. And question number one is, under the COVID Act, Cornwall Council has been given the right to ease some of its Care Act requirements. Has Cornwall Council exercised this right? And question two kind of, in a way, follows on from what Loveday was saying, which was that Cornwall Council had to close day services and respite centres attended by adults with learning disabilities, etc. At that time, carers report having their payments stopped before they had even been informed by letter. They were not given the option to use a direct payment to hire a personal assistant. So that's my two questions. Thank you.
So Councillor Ellenbrook, in the Strategic Director's statement, I set out how we'd responded as a council, social care as a council. So we haven't used any of the easements. Clearly, that remains under review, and the Coronavirus Act will stay in place and enable us to use those easements should that become necessary for a period of time. But no, we haven't used them. That second point, could you just expand a little on that second point, because we haven't stopped any direct payments.
No, it's. I think what they were saying was that, and as I say, I am simply asking a question that I was asked, which is that because daycare centres and respite centres were closed, that carers were not given the option of the payments that were being taken for those facilities to then be used for them to hire a personal assistant. So my understanding from the conversation that I had with them was that, let's say, as a for example, somebody has cares for somebody with a learning disability who would normally go to a respite centre, which obviously they pay for as part of their care package. When the daycare centres were closed, what an option could have been for that particular parent or carer would be to then buy in a personal assistant so that they still got that sort of respite facility, but they weren't given the option to do that. That, I think, is the nub of the question.
So I think it would be really helpful if you and I could have a conversation outside of the meeting and have some details, because we do not make payments to people with disabilities or to their carers to pay for daycare. They access that service free of charge. So we probably need to have a conversation so that I can understand the detail of that a little bit better. So nobody was stopped using the service, and we definitely did not stop any direct payments.
And thank you very much for that, because as I say, as I said at the beginning, I'm asking this question on behalf of, rather than it's anything from personal knowledge. But yes, I'm very happy. I've got a partnership board meeting tomorrow, so I'm very happy at that meeting to say, right, okay, give me some information and then I can feed it back to you. And I had noticed the answer to the first question in your report, but your report to the committee was marked as confidential, so I wanted to be careful that I wasn't allowing information out that I shouldn't have done, if that makes sense.
Yeah, that's fine. Thank you.
Thank you.
Okay, thank you. That is it regarding the questions. There were no other questions. I think Councillor Thomas, was that a question you wish to put, or did you just put that in the chat bar?
It was just more or less a comment. I mean, the person in question did insist quite strongly, and she did eventually get some more for the second day. But I think the concern she had, and I certainly share, is that if you've got to go to that extreme in your working job to try to insist that you get more than one set, I think whether it's a unique situation, Chairman, but I'm going to hear more of that. Now, is there a shortage of that sort of thing? Because I know there's a group in my locality of so far, I think they've made, and my wife's on that group, and made someone in the excess of 9,000 face masks for the NHS. So we just wonder if they are readily available now, where are they actually disappearing to, Chairman?
So we have no shortage of PPE now. Clearly, we're monitoring that situation. Again, if you could let me have some details, I will follow that up. Clearly, we are not giving out PPE unless it's required, and not all contact requires PPE. But if you can give me some specifics, I'm very happy to follow that up.
I'm happy to forward that, Chairman, through you. Thank you.
Okay, thank you, Councillor Thomas. Councillor Martin.
Thank you, Chair. Thank you, Helen, for that report, which, as you say, summarises a huge number of briefings that you've done, or your team have provided, in terms of all member briefings, and also the key member briefings, which were incredibly helpful for allowing us to keep our finger on the pulse of what was going on. I just want to flag up at a meeting, one of the key member briefings to do with adult social care in around April, we were told that 36 people had been discharged from hospital without being tested for COVID, because at that time it hadn't been the policy to do so, partly from, we know there was a lack of available tests. But we were then told that practice had now ended and there were no more. So 36 was the number of cases that we were told. And we said at the time, we would like to be told in due course how many of those cases then led to, or how many of the care homes that those people went into subsequently had outbreaks. But then more recently, there was a news article based on a Freedom of Information request that said actually 136 cases had been released from hospital into care homes without being tested. So I was wondering if you could help us to understand the difference between the number we were told in the key member briefing and the number that was given to a journalist, and why neither number is mentioned in this report, and what impact you think that might have had on the number of cases in care homes. I think we may come on in the RCHT discussion to talk about whose decision it was to release people, but just if you could clarify that number, why is it 136, not 36?
So I'm really sorry, Councillor Martin. I don't know why those two figures were different at the point. We clearly didn't share information that we didn't think was accurate, and I hadn't seen the FOI release until you brought it to my attention. So I'm sorry about that. What I can confirm is that as a system, we absolutely operated within the context of the guidance that was available at the time, and once guidance changed, we changed our practice as a system.
And were we able to find out how many of the care homes that those 136 people were released into without being tested? Was there a number of how many of them subsequently, either those individuals or people in the care homes, were confirmed as having COVID?
I don't have that information. I'm sorry, Councillor Martin.
I think it's important that we get that added to the record at some point.
Okay, thank you. Ms. Shields, you want to just reply?
So I've got the FOI in front of me because we thought it'd be helpful to share what it was that was sent from RCHT. And it was for the period the 1st of March to the 15th of April. Was asking how many people we discharged home to care homes, and that figure was 175. Of those discharged, how many were tested for COVID-19 before they were discharged, it was 39. And of those 39 patients, how many were positive? And the answer was 1. And that, if you remember, lockdown was on the 23rd of March. So we were only testing people who were symptomatic at that point. We were then asked a second question, between the 17th of March and the 16th of April, how many people we discharged to a care home with a positive test? And the response to that FOI was 1 patient.
Okay, thank you. Thank you very much, Ms. Shields. Go on to the next councillor, that's Councillor Jenkins.
Thank you. This is in reference to page 14, page 24 of our report, which is about care home testing and the confusing guidance from the government and where we are at with it now, in that the government or the letter said that every staff member should be tested on a weekly basis, but at one point they didn't actually have tests to be able to do that. Are those tests going through now in a satisfactory way, or is there still confusion about what's happening?
So I don't. So it's Helen, Councillor Jenkins. I don't think there's confusion. There are still issues to be smoothed out in terms of which people are most appropriately tested. So the government has said everybody should be tested. It isn't necessarily the case that everybody needs to be tested every week, because you can start to pick up a pattern of whether people are at risk or vulnerable, and those that we're focusing on in the first instance, those that move between homes or between settings. There is also an issue of consent with testing, and what Public Health England are doing in the Southwest are doing for us is coming up with a best practice approach that will enable us to know whether or not, or rather how we might best deploy testing so that we get greatest value from it, because you don't need to test everybody all the time to ensure that a setting is safe.
So just to come back on that, are staff getting tested on a weekly basis, even if they're asymptomatic? Or
if people want to be tested, they can be. We don't need to test everybody every week in order to make sure a setting is safe.
And do those staff have to go to a test centre, or are the tests available at the care homes?
No, so the tests get sent through to the care homes. They're being dispatched routinely now, but we can also send the mobile centre in if we need to.
Thank you.
Thank you. Councillor Ellenborough, please.
Yes, Chairman, I did forget to say this at the last thing, but I will say it now. I would like to express my personal thanks to everybody who has put these reports together. I think both Helen's teams and also the people at the hospitals and in primary care as well have worked incredibly hard under incredibly difficult situations and have always been open and honest and frank with us. And I personally find that really a very positive sign of the fact that Cornwall can and does work together when the chips are down. So it's just a big thank you to everybody for keeping us in the loop and making sure that we have as much information as they possibly can. And thank you too for taking time out of what must be extremely difficult circumstances for those people who have written these reports and presented them to us. So it's just a big thank you and well done.
Okay, I'm sure that everybody on the committee will concur with your comments there, Barbara. The recommendations, please. Deanne?
Sorry, slight technical hitch. So the recommendation is as laid out on the report. I haven't heard any amendments to that. Can I have a proposer, please?
I'll propose it.
Chair, can we add into it something about what Councillor Ellenbrook said about the appreciating the efforts of staff?
Okay, so that it becomes to note the contents of the report, but do we welcome the contents of the report?
I think we should.
And thank the staff.
Yeah, for all their hard work during the current period.
And then to agree to receive a future report, receive at future meeting an overview of the work currently underway to learn lessons from the initial system response to the pandemic.
Oh, we're all talking over.
Okay.
I think, Chairman, it's important to remember that it's not over.
No, it's not over.
This isn't the end. This is an interim report.
Mm-hmm. Precisely. Yeah, if you can add that all in.
Yeah, so are you happy to continue to propose?
Continue to propose. Do I have a seconder?
I'll second it.
Okay, thank you,
Okay.
Councillor Jenkins.
We'll move to the vote. A number of, I think Councillor Nicholas has left and Councillor Thomas have left the meeting. So let me just, and Councillor Kirkham has left the meeting. So Councillor Biscoe.
4.
Councillor Ellenbrook.
4.
Councillor Gammon. Councillor Gammon.
4.
Fantastic, thank you. Councillor Jenkins.
4.
Councillor Lennox Boyd.
4.
Councillor Martin.
4.
Councillor Parsons.
4.
Councillor Pollard.
4.
Councillor Toms.
4.
Councillor Williams.
4.
Fantastic. That's carried 10 votes in favour.
Okay, thank you. Move on to the next one, the Royal Cornwall Hospitals Trust COVID-19 response. Ms. Shields, are you taking this as your report?
Yes, please. Thank you for the opportunity to bring it. It's an adjunct really to what Helen's already presented because clearly we're part of the system. But the point that we really wanted to make is that this isn't over. So we've had phase 1 of our response to COVID, but it leaves us with the implications of a number of things that we had to do during COVID. So we stopped quite a lot of routine activity. We moved lots of activity off the Trelisk site into other places. And we have deliberately reduced footfall, ostensibly on the Trelisk site, but also on the other 2. We're now starting to see the impact of that we've still got restrictions on our visiting policy, which many of you as councillors will be aware of. We are trying to explain to visitors why it's important to not come back to our 3 hospitals yet. We regret the fact that many of our patients would benefit hugely from having their relatives with them, but we need to keep footfall and numbers of people on the sites to a minimum. We've got activity starting to step up, but we're still reduced in our ability to service it. So we can only get half as many people through theatres as we could before because we're having to treat everybody as having a positive diagnosis of COVID because of the process of intubation as part of an anaesthetic. So we are having to treat the most urgent patients, which means that other people are needing to wait, which again, through your normal everyday practices from the people you represent, you will be hearing concerns raised around people waiting for routine scans and routine procedures. We will hopefully be coming out to the public in Cornwall soon to be clear about what may need to wait for now, whilst we address those sickest people in the county. And we're working closely with all providers of care General Practice, the Duchy, UH Plymouth around making sure that we address the most poorly people as fast as possible. We're looking at additional diagnostics into the county. We don't have enough diagnostic capacity. So today we've got people on a call with NHS England to try and get more CT capacity and more endoscopy. And we are also asking for additional facilities, planning for a second spike. So we'll be looking for more intensive care beds and also a modular unit on the Trelisk site that frankly will be an insurance policy for Cornwall, that if care homes are in a position where they can't look after people safely in individual rooms, we will have a facility that we can start pulling people into to make sure that we look after them safely and other people in Cornwall. We know that any second spike will also challenge us around being able to treat the sickest people. So we're trying to work as fast as we can to get that backlog down, so that as and potentially when we have a second spike towards the last part of this year, we're in a position to be able to deal with that, and then we'll have to do this all over again. So we stand ready to be able to respond to any increase in activity, and within 72 hours we can go back to the arrangements we had in place before. But for now we're trying to get back to normal, and we just thought that the committee ought to hear the implications of what we've done, as well as the successes of us working together.
Thank you, Ms. Shields. It was interesting the fact that you were saying that you've got 2,000, delays in your operations, and those are the key people that you've got to get through. I will ask a question later on that matter, but I don't have anybody that's marked to ask a question. So can I ask what systems you've got in place to bring those numbers down in the immediate future?
So every specialty has got a harm review standard operating procedure, and we're asking them to go through all of their people who are waiting. There are some specialties that will have more cancer patients in them than others, so they have been the specialties that we've prioritised first. It isn't in this report, but we've achieved our cancer standards for the first quarter of 2020, so we're getting our cancer patients through. We're rolling those standard operating procedures out through one of our medical specialties so that we can make sure that we know who is most at risk. That by definition means that some people will be waiting longer, because we're moving away from the principle of 18 weeks driving access to care, and now that potential effects of harm or risk will drive access to care. So at the moment it's a 2,000 person backlog. We're hoping that will go down, not up. And we're using all of our resources, so reducing outpatient appointments, for example, to free up more clinical time so that we can see people and get procedures done and move people back into their normal lives.
Thank you very much. A very good reply. I had two other questions for you from Councillor Jenkins and then Councillor Martin. Councillor Jenkins.
Thank you. It's really good to see everybody working together so well and trying to make sure that we get a proper distributed service across the whole of Cornwall, although Councillor Parsons might chip in a minute about not mentioning North Devon. But are you intending to carry on having that distributed service and virtual outpatients clinics? Because actually with the population that we do have, having the ability to have virtual outpatients clinics rather than having everyone having to drive into Truro to do that would be a benefit in the long term, in my view. And actually having different procedures delivered in different facilities across Cornwall is also a benefit in terms of not having everything focused and centralised in one place. So is that something that will be part of the no going back, that will continue if we ever get out of this pandemic after the second or third spike?
That's exactly what we're planning to do. We know now that there are some outpatient appointments that are numeric, so we don't need to touch and feel you. We need to look at your scans and your blood results and your blood gases. So those sorts of outpatient appointments we want to keep with GPs and with people in their own places of residence, don't need to come into a central place to be seen. We're still around 50 to 60% of our outpatient activity being virtual. The next bit I want to ask is, we're following up people who are well. We need to stop following people up who are well, and we need to target that resource on people who are sick, and we need to keep that going forward. And there was a second question, the collaboration. What's really nice at the moment is I think we're almost organisationally agnostic, which means that we just aggregate around the people who need to be looked after. So for planning access for surgery, it doesn't matter whether it's general practice, the Duchy, RCHT or UH Plymouth. It's where you can go to the fastest in order to be seen. And I think we'll continue with that principle going forward too.
Okay.
Will you continue to use the St Michael's, for instance, for specific procedures, and actually maybe look at expanding some of those areas for specific things?
So all orthopaedics has moved back down to St Michael's, and trauma's moved back up to Trelisk. I've just asked 4 doctors to advise me, because I'm chair of the Planned Care Board. So I've asked 4 doctors to advise me about what we could do where. And one of those doctors is a primary care physician who's got an extended surgical practice, so that we can have more imagination about what we do in different places rather than what we have done. But there are some things that will be given. There are only so many places we can have a CT scanner or an MRI scanner or an endoscopy machine. And we need to make sure we plan accessible care around where those things need to be. But yes, we want to work through a web of services rather than blobs where people come into.
Great, thank you.
Thank you. Councillor Martin.
Thank you. Thank you, Kate, for everything that you and your team are doing. I know it's been an enormous effort for you to adopt very different ways of working, and some great progress has been made in things that we've been trying to do for years. So that's really positive. I just want to give you a bit of a mystery shopper experience that I had in the last couple of weeks with my wife having